Magistrate of Flintstone.
Welcome, everybody, to our work session for public safety. It's our fifth work session, budget work session. I guess for the record, I'll say I'm Chair Libby Garvey, and I've got here my Vice Chair, Takis Karantonis, and all our board members, Matt DeFranti, Susan Cunningham, and Maureen Coffey. And looking forward to this afternoon's work session. Reminder for folks that their videos of all our work sessions are on the county website, www.arlingtonva.us, and you can just search on 2025 budget information. And I guess I'll turn it over to you, Mr. Manager, but I'll say welcome to our sheriff, Mr. Quiros. Nice to have you here.
Yes, good afternoon.
Yes, the sheriff is so excited to be here. We've given him the entire work session. So over to you, Jose.
2 hours.
Yeah, actually, I might start kind of doing that when we get a little time.
Sure.
We do have several, but I'm sure you'll be brief. Go ahead.
For sure.
Yeah.
Well, good afternoon, everyone. Good to see you all. I'd like to first start off by introducing my team because the Sheriff's Office is a team effort here. So I have my Chief Deputy, Tara Johnson, Major Gretchen Foster, I have Major John Burgess, and Major Jimmy Barrett in the audience here. And I also have two of my staff members, which are really the heartbeat of the agency. So thank you for being here. Next slide. The next slide talks about our mission statement. To be a model sheriff's office known for the high quality of work, dedicated service to our community. That should be bold, and to the excellence of our people, the staff. It also highlights our 5 values of the sheriff's office. Next slide. The next slide speaks to the 3 key initiatives that I have as sheriff and for the sheriff's office to provide a safe and progressive jail focused on rehabilitation, to build community relationships, community engagement, and to support staff wellness and development. It also speaks to the 3 divisions of the Sheriff's Office. The next slide has a lot on there, and I know the board was given the slides prior, so you may have reviewed them. But I wanted to highlight a few things. Firstly, we implemented a swing shift into the detention facility specifically. That slide, yep. So we implemented a swing shift. I have 5 staff that are on this swing shift. It makes a huge difference in the daily operations. The swing shift starts at 11 a.m. and it ends, it goes into the night shift at 2100 hours. And so right in the when we get busy with meals, court picks up, ECOs, TDOs, the day just gets busy. This swing shift has made a difference, and it allows us not to go into these phases of lockdown as much as we would have to otherwise. I've also published our first edition of the community newsletter. This newsletter goes out to the Arlington community. It highlights the work that we do in the Sheriff's Office. First ever newsletter for the Sheriff's Office. What we did with the first one was I wanted to introduce the community to the sheriff and to my staff, my team. And so if you are wondering who is responsible for what in the office, it would give you an idea of who's in charge, contact information. Our next edition is due to be out in April, and we're going to highlight our community readiness unit and all of the programs that we provide in the facility. I also want to thank you for the funding for the upgrades in our roll call and our staff dining. It's a huge morale booster. It's where the staff really start off their day. It was overdue for an upgrade, and so that has made a huge difference. We donated over 1,500 pounds of food to AFAC this year, the staff, during the holidays. We also made donations to SIFA of 75 backpacks and school supplies. We're also in our 6th year of partnering with Virginia Hospital Center for Breast Cancer Awareness Month, and we donated over $3,000 this year. I also want to highlight something that I'm very proud of and acknowledge our partners in the police department. Chief Penn was very gracious to allow me to assign one of my deputy sheriffs to his community engagement division, and that was a first. And so Deputy Stephanie Ferris is assigned to the community engagement division, and she's really the liaison. I can't be everywhere. We're all in our roles, and so Deputy Ferris has done an amazing job of building those relationships and really sharing with the community at large what is the role of the sheriff and what are the responsibilities of sheriff, and getting to know a deputy sheriff. And so I know a lot of her work is in the Green Valley area of the county. Next slide. This next slide, a lot of information, but it highlights our corrections division, which is our largest division of the sheriff's office. As you may see with the statistics on there, we've had an increase of mental health and medical concerns amongst our residents. I'll refer to the people inside the facility as our residents. We're getting away from calling them inmates, so we say residents, so no one gets confused. But more mental health and medical concerns. We've already surpassed the numbers from last year, and we'll definitely pass those numbers by the end of the fiscal year. More hospital transports and ECOs, leading to challenging staffing challenges in the detention facility. We don't have staff specifically assigned for those assignments, and so we pull from the operations whenever we have a certain amount of ECOs and TDOs. I know yesterday we had 3, and so we had to send out 6 deputy sheriffs to the Virginia Hospital Center from within the operations of the jail. I also want to highlight the increase in withdrawal protocols and hospital transports, which I just spoke about, and ECOs and TDOs. Another one that I highlight, and I have to highlight this with all due respect to my staff, is the amount of staff assaults. You'll see last year we had 28 throughout the entire fiscal year. This year, through February, we had 37. And when I say assaults, I'm talking about staff being assaulted with urine, feces, spit on, punched in the face. And so these are an example of the types of assaults that the staff in the facility deal with. And we're, like I said, and the fiscal year is not over yet. Another area I wanted to highlight is the ADP, the average daily population, is we've gone from 292 last year to 357. And so the numbers on average have gone up by 60 plus. The next slide speaks to our Judicial Services Division, which is the courts, civil process, and transportation. This is work that is done separate from the detention facility, but this division is also has its staffing challenges, shortages. The staff that are assigned to the Judicial Services Division, I'd like to say, also support the detention facility after they've worked their hours, their shift hours. They will help out in the jail, which makes a huge difference. Our warrants and civil process section has 7 deputy sheriffs assigned to the section, and this fiscal year they've served over 22,000 civil papers so far, and that's in addition to evictions and extraditions. One of the numbers that I highlight here, I'd like to bring your attention to, is the last line, which says civil courts not staffed. And so last year, the fiscal year, we had 22 days where a civil court didn't have a deputy sheriff protecting the courtroom, assigned to the courtroom. And so this fiscal year, it's 37 days. And I know that's a concern to the court, to our judiciary, and it's a concern as sheriff. That's my responsibility to protect the court. But it's just, it's a challenge with staffing. To address that, and the county board knows this, and the county manager, I thank you for allowing me to provide funding for private security in the courthouse. And so we've implemented that, which has allowed us to assign those 2 staff to the courtrooms. The next slide speaks to recruiting and retention. We had $100,000 provided in FY24 for recruitment. This money was, I think we're getting a huge return on this investment. The funding covered the cost of job fairs and the overtime for staff to attend. And I'd like to say publicly that the staff has really taken charge and control, and they've owned this. They often will seek out opportunities to attend recruitment opportunities and bring people on board. The turnover rate has slowed this fiscal year. We're currently at 6.3% with a projection under 12% for the entire FY '24. And on average, we're seeing it's 14% and as high as 20%. And that's a stat that was from the National Police Foundation. And so I asked my team to make the box in the slide a little bit bigger for FY '24 because I really wanted to highlight last year we were at 16.9 turnover rate, and this year we're at 6.3, so an improvement. The current staff are really utilizing the referral bonus. We've seen an increase in staff referring, and there's no better recruiter than the folks that are currently doing the work. And so they've really taken that task on. 16 of our recruitment events were at no cost for setup. Staff, again, I said this earlier, they're reaching out and looking for opportunities in their communities and places that they frequent to find, whether it's malls, stores, gyms, different, even some amusement parks. Connecting with the community and getting the information out. So I think we're on we want to continue that momentum and that investment in recruitment. Next slide speaks to staffing. So I have currently 42 functional vacancies. Between the functional and the 43 vacant, that equals to 85. The overtime is still high because of the vacancies. Obviously, we can't fill. We also, it doesn't allow to fill different opportunities for staff to go into courts or civil process, transportation. Because of our staffing, we have to maintain the folks staffing in the jail. Out of the 42 functional vacancies, I have 32 at the academy. 32, excuse me, that would be great. 13 at the academy. I have 11 that are on FTO. They recently graduated. I have 3 new hires. I have 2 on workers' comp, 5 on light duty, 6 on FMLA, and 2 on military leave, which equals 42, just to give you a breakdown of that. Next slide is our equity slide. A couple things to highlight. I think there's some amazing bullets up there on the slide, but some things to highlight. We don't require a copay. We don't charge anyone to have to see a medical provider in the facility. The residents can sign up for sick call, and there's no copay. We just launched our mentorship program this week, long overdue, and I'm very proud of the work that the county's training through Jason Drake and Alini Brito, and they worked with our training section, but we launched this opportunity. I was at Lubber Run when we launched it, and the community was peeking through the window. They saw our whiteboard that said Sheriff's Mentorship Program. So it was an opportunity really to share with the community how we're building the next generation of leaders. And so we've partnered tenured staff, Major Foster's one of our mentors, with really new staff that just graduated the academy. And it's really great. I heard some of the feedback the first day. They're looking to grow and they want that knowledge. And so while the opportunity's there, I think it's a great win-win for the Sheriff's Office, for the county, and for the community. We've also recently added an ADA compliant van into our fleet. Also, long overdue. We were hiring a private transport service, expensive, and so being responsible to the county with being fiscally responsible and also safety, and now we can personally drive the person versus having someone else driving the van, so an ADA compliant van. Next slide speaks to some of the stats here on proposed changes. Funding for the independent medical position that we were granted out of closeout, more treatment for the MAP program, and implementation of body-worn cameras which is something I am very, very interested in for the detention facility, and freezing the 2 positions for, maybe I didn't get that one. The next slide is a lot of numbers and not my favorite slide. We can, if you're good with it, we can move on. I want to get to questions and leave enough time for my partners in public safety to get their time. So this is my favorite slide. I shared this with my staff. I said, look, when I'm before the county board, this is going to be my opportunity to close my my thoughts and drop the mic, and then these are my ending thoughts. But it really speaks to the priorities. And so here you see that recruitment, obviously retention, body-worn cameras, staff wellness, and the MAP program. And so like I told my staff, out of the 5 bullets, 4 of them speak to them. And I will share with you a plea. The sheriff's office runs on people. And while I have 2 staff here, they represent the entirety of the office. They are the ones that do the work. They are the ones that are here when 24/7, the facility's open 24/7, and they're ensuring the safety of the folks that are in my charge as sheriff, and that we're responsible for in the community. I think the last piece I'll speak to is a couple of things, and then I'm done, is I'm working on a strategic plan. I will finalize that plan and complete it by the first week of April. I realize that there's a lot going on in Jose, the sheriff's brain, and it's not transparent, and you can't see through this. So putting this plan out, and so to share with the leadership and to share with you all and the community, right? Where is the sheriff's office headed for the next 2, 3, 4 years? And what are the priorities? How are we going to get there? And so I'm committed to providing that plan. I think it's going to be a very useful tool to not just as a leader, but to you all and to the community. And that is, I have a couple of notes here. I think the continuation of the 1.75, that 1.75 overtime for the jail has been a huge, huge help for us to continue operations and really for staff morale. It speaks to people want their time off, and people need their time off. That speaks to, I said, staff wellness is important to me. And so you can't just be at work all the time. And so, you know, if we're gonna ask staff to, you know, miss, you know, the child's game and miss this event, I think it's only fair to reimburse them appropriately. Yes, jail premium, I spoke on that. Another thing I have to mention is compression pay, right? It's huge. I know that there's many considerations that you all have, the 5 of you as the board, but I say this all the time in roll call, and I know I've said it to you all in our interactions, is my staff, the bulk of them don't live in Arlington, and they travel here every single day while they could stop where in the county they live in, and we want quality people here. We need quality folks, and they want to work here. And I want them to stay. I think we all want them to stay. And so it's only fair for them to be, again, reimbursed, to be paid, and specifically compression. You know, I spoke to a staff member the other day, and they said, initially when I started, at 16 years, I would have maxed out. I'm in my 16th year. I've missed a few pay increases, so now I'm maxing out at 20 years. And what does that mean for my family? You know, the kids aren't waiting until my compression and my pay catches up. Kids eat, kids grow up, kids need to go to school. Things get expensive. I have another staff member who has had to move 3 times because their rent has increased every time. And I don't know about you all, but moving's not easy. It's a lot. And this person has 2 young children. And when the rent goes up, they have to move. And that's if you ask me, that's not fair to public safety, someone who's serving our community. So I think that if I missed anything, Chief Deputy, okay. I think I'm done.
Okay,
I don't
ready
know
for
what my time
questions.
is, but
Thank you. Thank
thank
you
you.
very much. All right, thank you so much. Colleagues, questions? I assume there are some. Mr. Karantonis, first with the light. Go ahead.
Thank you. Sheriff, that's all very interesting, and I have to preface that by saying that we are well aware of the extraordinary work that all deputies are having to do because, the resources are constrained. I understand that. So we are here in a quest to find ways to alleviate that and to allow you to manage it better. I have one question on your slide number 5, which is something that so the withdrawal protocols from 530 in fiscal year 23, we are not yet through the last quarter of fiscal year 24, and this is almost twice.
correct.
So is that the commanding, is that, for example, does this explain the additional, the more assaults, the increase of the population, et cetera? Is that the critical number?
Yes. And so how do we get there? So when someone is brought into the facility by the police department, or if we are remanded by court, they're screened by mental health, medical. And so when we ask someone, the questions, have you used opioids? Are you going to withdraw? Do you have a history? And so then we flag the person, they're put on withdrawal protocols. And then that whole process is separate from, just the normal commit, someone's coming into jail. And we see that more and more and more. It requires more from the medical team. It requires a lot more supervision from our staff.
So you said the critical word, the medical team. So I understand that this is a supervised withdrawal, right? And I've seen how tight the situation is. So what does it mean for the medical team that you have today, or the provider of medical services today? And how does this jive with the additional doctor or physician that you are asking for? Do you expect that this will be making a real difference there?
The new position?
Yes.
Absolutely. What I ran on and what I believe is that we need our own county-run medical. Mm-hmm. The county need to be involved, and we find ourselves involved, but I'm not a medical professional. And so I need someone that's going to support the office and really support the county and the decisions that are being made and the medical care of those in custody of the sheriff. And what I didn't say, and thank you, Chief, is that folks are given a drug test by the medical vendor while they're in booking. And so they're given a drug test. It's not part of anything, we're not looking for charges. It's part of the medical process. And so that also assists in identifying who's going to go through withdrawals, what's in their system. And I know the medical vendor uses the COW score, and then there's a process to see where they are in the withdrawal protocols. But to your point about the independent medical position, absolutely. That person would be responsible to the sheriff, would work hand in hand with the office. And obviously I work for the community, I report to the community. And so I need that person to give me, because right now we have a medical vendor, and the medical vendor is contracted. Mm-hmm. And so if I have an issue with a doctor, none of us on my team have medical licenses. We're not doctors, we're not providers. And so I'm really going off of what the medical vendor, contracted vendor, is suggesting as to the care of the person. Now we definitely get involved and have a say, but I don't have a background in medicine. And so I want someone that has that area of expertise to be able to provide me with dedicated advice. Yeah.
Thank you for that. So to be clear, withdrawal protocols includes also alcohol, withdrawal from
Correct.
alcohol for intoxication.
Correct.
Right? Is that more prevalent, or is it more just drug?
We see it, I mean, but it's not the opioid withdrawals.
The opioid withdrawal is the,
100%.
and this is what motivates you also to discuss, these bracelets that have
Biometric
biometric.
sensors.
And this would work with this kind of,
Yes,
because, the one thing that has been in discussion in our community is, we had 2 deaths in 2 years and
Yes.
a history before, but especially the recent ones. Everybody's asking, how can we improve the medical supervision?
Correct.
And, okay. Okay, that's, I yield, Madam Chair. I
Fine.
took too much of your
Matt?
time. Thank you so much.
Thank you, Madam Chair. Sort of picking up where Mr. Karantonis had a couple of questions, and I've had we've had a lot of conversations, and I think it's just for our community, it's important to sort of lift up and understand. I think many people in the room know, but I'm not sure everyone knows, we had a medical provider 2.5, 3 years ago, and we changed medical providers because it was a problem, and or because we felt we needed to. My understanding, I think I've seen a look, there is a new contract for medical services that involves tons of different providers. What this position is that we worked on last year is one person who can help you have a resource. But to go all in-house medical for the large number of positions, at least that I recall, that's in that contract, would be extraordinarily difficult. Like,
Sure.
We're talking parts of 20 or 30 people's time. And so while that might be what we all could wish in an ideal world, it's also the case that doing that overnight is not easy and not possible in the coming months. It would take a long time, and the cost, that doesn't mean we don't want to do it. So with those things established, I just think I'd sort of like to surface the position we approved in closeout has 205,000, but my understanding is that was sort of a high-level physician's assistant or not a doctor. And now, at least my impression is that, and just to be transparent, I will be looking for more ongoing than 205,000 to find a doctor who can help you both down at the intake, but also not 24/7, because that would be $1 million in ongoing, probably, but more than this, to find a doctor who could be, 8 to 6, 9 to 5, whatever, that can be a resource.
Right.
And I don't know, that seems important to me, and I don't know if you can speak at all to that, or we have had, can you maybe describe what we've done on trying to find the position approved and where you are on the possibilities of the next position? And
sure.
so,
What I'd like to mention also is that I recently had the National Institute of Corrections do a reassessment of the detention facility, specifically our medical care and our psychiatric care. And so the NIC sent 2 medical experts, 2 doctors, 1 in each area of expertise. And it was their recommendation that we have what they call a CMO, a Chief Medical Officer. And this person would oversee the medical care, the psychiatric care, which currently we get through, we have also DHS supports the jail with the 16 plus therapists that are assigned to the facility. And recently, my chief deputy had a conversation with Dr. Varghese, and it was his recommendation that we had a doctor level medical provider on that level of provider working with the Office of the Sheriff to provide oversight for the contract. And I see these 2 physicians working hand in hand, both this position, the independent medical provider, and our current contracted doctor working together to make sure that folks are getting the care that they need.
got it. And my impression, once the report, the NIC report is complete, will you share it?
Yes.
Okay.
Yes.
With the community, I think that's important.
Absolutely.
So I'm mindful that others may have questions. The medical devices, it's my impression that we have 12 to 15 that are operational primarily in the medical unit, but, you know, one of the fatalities in the past year was someone not in the medical unit, and thereby did not have a medical device. And so, you know, I wonder, an area of is whether expanding the number of medical devices is something that you have thoughts on.
Yes, so currently we have 12, currently the biometric sensors are assigned to the medical unit. And inside the medical unit, I have 12 cells. So potentially 12 people can wear these devices. And so that the entire housing unit, the medical unit was outfitted with what, you know, the technology that was needed for these sensors to work. And so if you're not housed in the medical unit, then you wouldn't have a device. I'm interested, I think that, you know, you spoke on things being a huge lift. I think immediately we're looking for some support in our mental health unit. And also when folks first come in, I think that's when folks, we see the most, you know, amount of issues when they're first brought into the facility. You really don't know what they're on, what condition they're in. And it's really like a ER type situation. And we are not an emergency room. We don't have that capability in the facility.
Thank you. I might have another question, but I'll yield.
Okay, thank you.
Thanks. Yeah, I think picking up where you're actually leaving off there, one of the things I've been struck by as we've gone through this and touring the jail and getting more involved in this system is the extent to which our system criminalizes addiction and mental health and homelessness, and the fact that the purpose of the jail is not to treat mental health, and yet that's how we are utilizing our jail system. And when really these people deserve to be treated for their underlying health conditions and not to be criminalized and not to be punished for things that are medical. And I'm wondering if you can talk a little bit about how you all work with diversion to ensure that the people who really need other forms of treatment aren't the people who are just sitting in jail. Like, how do they actually get the assistance and the services that are more rehabilitative and will get them on a pathway to stability?
Turn your mic.
Got this last year too.
Nope, turn it again.
When red is on.
There you
That's
go.
all.
Oh, red
I
is
was
on,
looking
and yeah,
for the
it's
red
weird.
bottom.
Red means you're on.
Yeah.
So as far as diversion, our DHS staff that we have inside our facility, they will, upon people coming in for commitment, will possibly go down and see if there is a way to be able to divert somebody. If not when they first come into our facility, after they're committed, they'll go down and assess them. And many times they'll go back in front of the magistrate and say, this individual needs to go out on ECO. Their bond will change, and then we're able to take them to the hospital on an ECO status. That underlying charge may still be there initially, right? So we're not generally involved at the point of the beginning of bringing them in. So all we can do is after they're in our custody, use our resources through DHS, and then see about getting them sent on an ECO. We also have the behavioral health docket. We have pretrial officers who are on that docket as well to help. But again, that's after they've come into our jail. So we really don't have a large impact right now before somebody comes into our facility to divert them. And there's one other point I was going to make, but it has since left. But yeah, and that's basically it.
I appreciate you sharing
thoughts on
that.
it, yeah.
Yeah. I think just a thought that I've been having listening and in this process and conversation is we have joint sessions with DHS and CPHD on housing. Perhaps it's time for a joint session with public safety, courts, and DHS on mental health and substance use, because I think, we're asking you all to do a lot of things that are outside of really the scope of law enforcement and of the jail. And so figuring out how we can run systems a lot closer together. I know you all have DHS staff. I know you have DHS therapists and professionals within the jail, but I think looking at how we fund this system more holistically and whether the right place for funding is the jail or DHS or actual medical care is a conversation we really need to engage in, because I'm not sure that we're going to solve this problem by making our jail into a mental health hospital as much as we are to actually do the prevention work and actually invest in mental health services outside of the criminal justice system.
Can I add to that really quickly? I know DHS had spoken with us recently. I think they are intending to either ask for a position or one has been already implemented. I don't know which, but I know it was a conversation. I also think that the issue is even having the person to do the diversion is, where do we take these people? They end up going to the hospital. They end up sitting in hallways. The police run into the same issues if they can divert them ahead of bringing them to jail. And they end up sitting in the hallways of the hospital, or we can't find a bed that's available for them to get to. So we have staff that are sitting on these individuals for days. I mean, and not even just one or two. I mean, it goes into close to a week sometimes that, you know, we're having a staff or two staff out there to just stand in a hallway. And they're often, you know, very violent, or sometimes we have to send out a third person. And that's, I think, it's a bigger issue almost than just a person to do the diversion. It's where are they going? So I think that would be really valuable.
Thank you for adding that. Thank you.
I wanted to say one last thing. Sorry.
No, go ahead, please.
Ms. Garvey, is currently we have 16 or 17 DHS therapists that are assigned to the detention facility. And recently I had a conversation with Anita, and we want to make sure that, you know, we're being proactive and not reactive with the care that we're giving. I'm grateful for the relationship that I have with Anita and Deborah because they were very open to that. And so that was part of the NIC assessment, not just on the medical side, but DHS side, that we want to, and to your point, Ms. Coffey, we don't want to turn, you know, the idea is for the folks to get what they need, and they don't have to get that inside the facility. And so, yeah. Years ago, when I started in 2001, and everyone before me, we had 3 therapists in the entire facility for almost 600 people. And so now we have 16, 17 for 350. So there's an opportunity to do work and to help folks. Yeah.
Thank you. Ms. Cunningham. Susan.
Building on Ms. Coffey's comment, I'm actually curious, if we've got 2/3 of our residents with a serious mental health diagnosis, should we be standing up a mental health hospital or a mental health floor of the jail? Or let me put it this way. If we were to start today and we didn't yet have a jail, how would you design services to meet this community?
I would want services that allow for someone to get care, but they wouldn't necessarily have to be incarcerated to get care, you know. And to your point, that we're on the receiving end of this model, public safety, and that is our charge, and we signed up for that. But there's a lot of folks that need help, and we know we want a safe community. I live in this community. I want to be safe. I know everyone wants to be safe, but isn't. You know.
And even in our mental health unit now, 21 cells, 21 on one side and 8 on the other, and it's always full, always. And I think that, you know, our DHS team, they do a phenomenal job of, you know, putting the folks that need to be there. The bad news is that if we're all in the mental health unit, they take the best of the worst and move them to another location. So what we call is overflow of mental health. Those individuals need often just as much care. They're just housed somewhere else. So we're trying to integrate them back into other living conditions because our space is very small. I mean, we do have that one, the 11th floor is specifically mental health and then some administrative issues. But overall, the space, because mental health has increased so much in the last couple of years, we are now drowning and bleeding over into almost all areas of the jail.
The mental health unit, I know you've all been there, it's one floor. The rest of the jail is built into tiered housing units. So we can't put someone who has mental health concerns where there's a balcony or the ability to jump over the rail. And so it's a concern.
Great. I'm also curious on the medical costs. I know you've made a number of changes across the last couple of years. What's the total cost of medical? Like, how much has it changed in the last 5 years? And what's driving that?
We might have to get that information to you. I think it's roughly a $5 million contract, if I can go off the top of my head, but we could.
It'd be great to
definitely
know
do that.
how it's changed, and is it, the number of residents that's driving that, because it's COVID and all that. So you may even have to go back to 19 to have anything to
Well, and
compare
we
to.
did- I know that we took, there were 2 positions that we had under Medico, and it was not as useful because we do have DHS inside the jail. So Sheriff's Office actually identified that those 2 positions were not being utilized as well because often, like, CSBs are not embedded into the facility where we're very unique and resource heavy there. So those 2 positions were upgraded. So we absolutely can get you that information.
Great. And then I'm curious on the medical bracelet pilot, what have been the outcomes? What have you learned? What are the metrics that you're tracking to decide whether to expand it?
Right. It was definitely, it's something innovative. I think it's where detention facilities and jails are headed to. We had the opportunity to pilot it since the summer of last year, and now we fully implemented it early in January of this year. I think it's the number one thing I think you need to remember about these bracelets. It's a tool. It's a tool. It's not going to replace the interaction from the staff and what that human interaction. But it's definitely a tool. I was in the medical unit yesterday, and the tablet has everyone's profile, and it alerts. It's green when everything's fine, and then there's different levels, yellow and red if there's an emergency. But I think it's an opportunity really we're in 2024, and there's technology that can assist the staff. The staff can't be at 12 cells at once. It's just impossible. And so we just spoke about that today in our meeting of capturing the stats, and we can also provide that to you.
Yeah, that would be great. I think as part of your strategic plan and as part of any pilot plan to understand what metrics you're looking for, it's fun to try out new toys and tools, and it's a good idea to try to innovate, but we also want to evaluate whether we're getting a good return on investment. Okay, last one is the Alcohol Safety Action Program. Can you say a little bit more about what those 7 FTEs do and whether it's crucial to have that scale?
You want to take that one, or I can?
Go ahead.
Okay. So the Alcohol Safety Action Program is it's unique here in Arlington. In a lot of jurisdictions, ASAP is on its own. But in Arlington, the ASAP program is under the umbrella of the sheriff and under the direction of Tara Smith. She's the ASAP director. And so it's a program, court-appointed program, where if you get a DUI, there's something the court sees that you need some services, they assign you to the program, and you have to complete classwork, the interlock system. That if you get a DUI, you have to blow into the tube. All that is under ASAP. And so they also have a caseload. They have 2 staff that are Spanish speaking, and so there's 7. Obviously, the director, and then 7. I believe 1 is a technician, a receptionist. But it's one of the under the umbrella of the sheriff here in Arlington, I have besides the office of the sheriff, I have ASAP and I have pretrial, which in other jurisdictions are on their own.
Okay,
So it's
great.
part of my budget.
So it feels like it's the right size team right now.
I believe so.
Yeah, I would say their caseload, it varies, and I would say they are never without clients. But I think at this time, it's probably, at an okay FTE.
Great. I just want to say thank you. I appreciate the welcome I've had. Someone loaned me a quarter when I forgot to take my quarter for the cell phone things. And I just appreciate all the work that y'all do.
Thank you.
All right, colleagues. Mr. DiFranti, I know you have one more question. I will go ahead, but we are already a little over our time. We have several more to go, so we'll just make it quick if you could.
Sure, won't be a question. I want to follow up on the 1.7, the time and 75% on the hourly, because I don't know, I want to be sure whether that's in the budget or not, and think on that. On compression and staffing issues, I think about whether I could do the job of a deputy, and I have a lot of doubts about that, to be honest. It is a hard job, and so anyone who would want us to do better, it's useful to be humble about whether you could do the job and how hard it is. Compression, I know, is urgent. We also we have in this budget some folks that we're not going to be able to keep next year in the budget, and so I think about compression. I also think about what else we can do to try to see if we can address some of the compensation issues, keeping in mind we have requests from all public safety entities with respect to more funding. And then just, I hope that we can, to the extent that there's work with the police chief on the two fatalities, I think there's some, on Ms. Wilder George's, there's some information there that we can share, and we've talked about that and share publicly that with respect to the cause of death being natural causes and the rest of it not yet being complete. I just think that is important to state, and so I hope that's okay to share, and I want to give you, Madam Chair, and the sheriff the last word.
Okay, thank you. So thank you so very much. As I am wont to do lately after my 12th year, and this is my last one, I find myself thinking back to when I started, and I think Ms. Coffey sort of stated it the most succinctly, that we're criminalizing medical issues, and that's become really clear over the last 12 years. It wasn't so clear when I started. And I find myself thinking, Mr. Manager, bringing together DHS and court, this is a great idea. I feel like we've just been putting Band-Aids and trying to, we've got, maybe it's square boxes and we're trying to fit the round pegs into them and it's not working. And if you were going to design a system from scratch, like just look at the situation, forget about what we have now and figure out how we should handle it, what would we do? I don't know what that is. I don't know if anybody's doing that work somewhere nationally, but it seems to me I feel like we kind of need to step back, take a deep breath and really just do a clean slate and think it through maybe over time. This is not a quick thing.
I know Mr. DiFranti is working with the Criminal Justice Coordinating Council to try to make that a place to have some of those conversations. The other place that I frankly, this is just a personal view I have, which is that a lot of the challenge, and you could talk about this when Chief Penn comes up here, is the way the Code of Virginia is written. And I think everyone around this table would like us to be able to provide more care and empathy to the people in our community. But the way our criminal code is written, it really limits what we can do. And I know that Jose and his staff are often on the receiving end of what is coming in through the arrest process. And you could talk to the chief about this. There are a number of things that I think that are criminalized in Virginia that simply shouldn't be.
Right.
And so I think that I don't say that to frustrate people. It's just, it's a very large issue.
Oh, it's huge, and I realize that it's a long-term thing, but thank you for bringing up the General Assembly and the code issues. It's maybe something we could get a plan where we want to tackle it. It won't happen quickly. Maybe we get a Democratic administration and people start to finally kind of understand what's going on and how we really need to do it differently. We get there. Because I think you are on the receiving end, and thank you for everything that you do trying to, all of society's problems end up in the jail, and you're given very limited tools with which to handle them, and I appreciate everything you're trying to do the new things. We look forward to the strategic. Thank you. All right, I think with that, we're ready for the next group. Thank you so much.
Thank you.
And yes, thank
you
you.
all.
No, thank you. Great to see you.
Great to
All
see
right.
you.
Arlington County Department of Public Safety, Communications, and Emergency Management, which I still call OEM. Is that all right, Mr. Flagler? I find myself always trying to think, what is the name? And then I always just revert back to that. All right. I don't know. I think I'm supposed to turn it over to you, Mark, and you introduce people or something like
Yeah,
that.
I'm going to turn it over to Mr. Flagler, who is here with his awesome command staff team.
Thank you, Mark. Good afternoon, and thank you, Mr. Mark Schwartz and Madam Chair Garvey, and esteemed members of the board. Before we go any further, I do want to pause and recognize the incredible people that make up our department, the wonderful 911 public safety telecommunicators that are working 24/7, the situational awareness and intelligence analysts that send out the wonderful Arlington alerts, our emergency managers, and the people that help us with our engagement and manage our volunteers. And I'd also like to thank them for their dedication and all they do to make Arlington safe for people to live, work, and play. And before I go on, I've been in this job a year and 20 days permanently, and in a rare opportunity in a leadership situation, you get to actually create a whole new team. So everybody here is pretty much a whole new-ish team. Some of them have been here in the county for 10 plus years and stuff like that, but they are a newish team. And so I want to introduce them today, and I'm joined by them. I have Jake Sauer to my right here. He is the Emergency Communications Center Administrator. I have Jessica Baxter, who is the Chief of Administration and Public Affairs. And then I have Hannah here, Hannah Wynot, who is the Deputy Director for the department. And also joining us today is our Chief Financial Officer, Jeff Bergen, because I can't handle a calculator. So thank you, Jeff, for being here. So I do want to thank you for your time and attention today. So let's dive into the priorities and impacts that lie ahead for our department. Next slide. Today, I'd like to speak about the essence of our department, the guiding vision, and the mission that propel us towards realizing a safe and ready Arlington. We achieve this seamlessly by coordinating emergency preparedness and response capabilities, leveraging resources, and engaging in proactive outreach. Our collective aim is to save lives, safeguard property, and offer crucial assistance to the Arlington community. Next slide. So here in this slide here, let me wait till, yeah. So here in this slide, you'll see what these award-winning people are in charge of. And I do say that our department is an award-winning department. Recently, we won the County Manager's Award of Excellence, and we won an award for Homeland Security today because we partnered with the Department of Technology Services on a tabletop that you guys had fun in dealing with cyber and COOP, and that's something that we did with every single department. And I think we just also went to the Virginia Emergency Management Symposium, and we presented on some of that as well. So this has become a national model for a lot of agencies, and we're getting a lot of conversations about how to do this in the region. So now I can go into how we meet our mission for our community, which I explained earlier. It takes a 24/7, 365, and this year 366, I know it's a leap year, approach to this mission. In the Emergency Communications Center, we serve as a lifeline to our community, ensuring rapid and effective response to emergency calls through 911, voice and text messaging. Our integrated radio dispatch system facilitates seamless communication between call takers and first responders, ensuring swift resource deployment and effective incident response. In emergency management, we proactively plan, mitigate, respond, and recover from potential emergencies and incidents. We also provide vigilance for round-the-clock awareness and threat monitoring. In our Administration and Public Affairs Division, they provide the department with the essential support through finance, budget, and human resources, as well as the active pursuit of cost recovery for financial resilience and supporting emergencies. And they don't do that just for us in that unit. That unit is also responsible for the FEMA reimbursement process, which has recouped about $50 million for the county in over 10 years. We also have a robust communications and volunteer program engaging the community to strengthen the emergency response efforts. And this, again, is our effort to meet people where they are and not follow the traditional government models to tell them to come here and have a conversation. And we are also, as you can see, in charge of radio communications, and we coordinate the public safety voice radio technology countywide for unified emergency response. And you may not know this, but we also support radio communications for non-emergency day-to-day communications. For DPR, for DES, for CPHD, and also for APS. That all goes through us, among others. Next slide. I'm excited to share with you the major priorities shaping our department for the FY25 budget. These initiatives represent our commitment to innovation and enhancing emergency services. And now I will turn it over to Mr. Jake Sauer.
Thank you, Will. Madam Chair, board members, Mr. Schwartz. I'm going to talk a little on updates to the Emergency Communications Center. We've introduced text to 911 capabilities, ensuring a modernized and accessible emergency communications channel for the community. New features enhance our ability to respond effectively, including improved translation services and heightened location accuracy for faster emergency response. This furthers our next generation 911 capabilities by implementing a new computer-aided dispatch system. And this system serves as the brain of the county's public safety infrastructure and seamlessly connecting emergency calls to the Emergency Communications Center, which in turn dispatches the necessary public safety resources to the incident. We've introduced Amazon Connect. That's a system that redirects non-emergency calls to appropriate reporting channels, allowing our staff to prioritize and focus on 911 calls. And the ECC is undertaking a comprehensive accreditation process to assess and enhance the efficiency of our 911 operations procedures, technology, and training programs. We are implementing standardized call handling protocols to deliver consistent customer service while minimizing call taking time and optimizing our response capabilities. And you'll see in the capital improvement update that's coming, I think you have next week, we have a large computer-aided dispatch upgrade that's coming for 24-25. Next slide. We are excited to report on progress on outcome measures and goals for fiscal year 2025 budget process. Performance measurement and reporting is something that the Department of Public Safety, Communications, Emergency Management has always focused on with our projects, both reporting to the public as well as internally to help with our own priorities and decision-making. For fiscal year 2025, we decided to highlight the work of the 911 Center, as we mentioned earlier, a lifeline to our community, ensuring rapid and effective response. We wanted to highlight the progress and measurements here where we talk about measuring that rapid and effective response. And on this slide, you can see the dichotomy between output measures, where we are talking about our workload and volume, which does tell some story as compared to our outcome measures. In the industry, there is a national standard in terms of call answering and processing, and jurisdictions around the county struggle to meet this. We are getting closer, and we are working on the harmony of efficiency, which is the speed part, combined with the effectiveness of the dispatch. We have talked about our call handling protocols, and when those are implemented, we will have a much better idea of how those work together with our efficiencies. Most importantly, however, is that we use metrics within the department. They are part of how we allocate resources, set priorities, and make decisions.
Thank you, Jake. And next, I'm going to take director's privilege here and introduce you to Hannah Wynot, who is recently from the VEMA Symposium, and she has been named the new Outstanding Emergency Manager of the Year. So thank you for that. I'm not done. Our department is fantastic, like I told you. And we have three women who are also recognized as 40 under 40 from the Leadership Center of Excellence, and two of them are here today, and Hannah is one of them. So I will now turn it over to Hannah.
Okay, thank you. Yes, as Will mentioned, my name is Hannah Wynot, and I'm the department's new deputy director. I'm working across our emergency management programs with our fantastic team, as Will mentioned, to increasingly take a more proactive stance to identify and collaboratively work with our partners at the local, state, and federal level to plan for our response and recovery to emerging threats and hazards. For the next year, those include extreme heat. We're working across our county departments to develop operational plans so we can quickly make decisions in extreme heat and air quality emergencies to protect the health and well-being of our staff and our residents. Building towards cybersecurity, working on the success of our Continuity of Operations series and working with each department's Continuity of Operations, or COOP lead, to identify how we will respond to cyber attacks and to continue to deliver essential services to our residents. Working with our Department of Environmental Services for the next year to build out a debris management dashboard. This is directly in response to the microburst storms that affected us last summer, right? We know weather is going to get more extreme. The consequences of that will be more severe. And so we're working to develop a visualization dashboard that will help us identify exactly what the debris picture is across the county and the strategies to manage that debris. We can articulate that to you, our county leadership, as well as to our residents. And of course, in the very near future, working with our local, state, and federal partners, including the Center for Homeland Defense and Security Studies, to plan around threats, hazards, and of course the response and recovery to them related to the 2024 presidential elections and the presidential inauguration. None of this would be possible without coordinated information, right? Understanding those threats and hazards, both potential and confirmed, and being able to communicate them out to you, to our internal staff, and to our residents. And that's only possible through the build out of our new Situational Awareness and Intelligence Center. That's essentially an expanded, bigger, better version of our watch desk with a really comprehensive focus on the recruitment and the retention of top tier staff to help us do that. So that's a little bit about what we're looking at in those deliverables for the next year, but on the next slide, I'm going to talk at a higher level around exactly what emergency management does as it relates to you and to our county partners. So this slide visualizes where emergency management falls in our county workflow, right? So we receive strategic direction from you, our leadership, through laws, policies, regulations. That's what we need to do. We have this amazing breadth of tactic operations experts across the county, whether that's first responders, our firefighters, our police, roadwork experts, and DES or public health nurses. And emergency management serves in the middle of that, bridging the gap of what we need to do and coordinating people, information, and resources into how we do that. And so to talk a little bit about that, I will pass it back to Will.
Thank you very much. And like I said before, we have made history again with the Leadership Center of Excellence, and now I will introduce you to another winner of the 40 Under 40. I don't think they've ever had 3 people from one agency win, so I will now turn it over to Jessica Baxter.
Thank you, Director Flagler, and good afternoon, members of the board. I'm excited to share with you our engagement and outreach efforts, our impact and reach into the community, as it's one of the most important things that our department does. This slide really does show a snapshot of our metrics. On the left-hand side, you'll see our various tools. And everything that we do it with equity in mind, inclusive and representative engagement. For Arlington Alert subscribers, we are nearly at 32,000. While we have experienced growth, that number has stabilized. We have experienced anywhere from 1% to 5% in growth quarter to quarter. But we also know that Arlington is rich when it comes to digital and communication tools. It's something we take very seriously. So in addition to the Arlington Alerts, we've experienced significant growth in social media. We have over 20,000 followers now over our 2 X platforms, which is Arlington Alerts and Ready Arlington. And then, as Jake mentioned when he's talking about Next Generation 911 and the efforts that we're doing there for equity, we are now offering 172 languages in translation for our text to 911. So this is a great and incredible thing. If people have the language saved in their settings on their phone, when they text 911, that gets translated to us. And then when we send something back, it gets translated back to them. And that's in 172 different languages. In the middle, we'll have the Until Help Arrives. This is our flagship program that we've delivered to the community for the past 2 years. This service really does provide the necessary life-saving skills in the event of a mass casualty event and those critical moments afterward when first responders are trying to get on the scene. So in the community, we have trained approximately 934 community members, over 1,000 employees. And First 15 is our branded, targeted program for Until Help Arrives for faith-based organizations. So far, we have trained 108 members of the community through that. But I will say that we have shifted our approach quite a bit, and we've seen the demand surge on First 15. So where we've sort of plateaued in UHA and delivering that for the general population, First 15, I will say at the beginning of the year, we worked very closely with the county manager's office to reach out to every single faith-based organization across Arlington. And all of the calendar offerings for 2024 have been booked this year, and it was very fast. So it's exciting that we have more people that are going to be trained, particularly in vulnerable organizations such as faith-based organizations. On the right-hand side is our FY24 general engagement numbers. We have reached over 4,100 people through a collection of more than 65 engagement events. This includes all of our trainings, UHA, as I mentioned previously, pop-up events, community events, and more. Next slide. So none of this would be possible without our amazing and dedicated volunteers. They truly are an extension of our work and represent the success we've had in connecting to hard-to-reach and vulnerable populations. The first one being Community Emergency Response Team, that's our CERT. These dedicated members represent people in the community that live in neighborhoods across the county that have been trained in FEMA curriculum to respond and prepare for disasters and emergencies. They are incredible. Many of them also deliver Until Help Arrives trainings for us. They're the instructors, and we rely on them quite a bit to deliver that. It's a hand-in-hand collaboration. Community Advancing Resilience and Readiness Together, CART. That's something that we also put together 2 years ago. That's a county manager-appointed committee that also shifted to a more proactive approach similar to the Complete Count Committee, similar to the Complete Vaccination Committee, to have a strategic partner in place in the community. These community members are leaders across various sectors. They are seen as trusted partners into hard-to-reach populations, and they really serve as our strategic partner in helping form our engagement processes so that we're reaching equitably and thoroughly into specific populations. I would say that these people also are instrumental in delivering presentation materials and community events, one of them being MLK Day of Service, and the other events during Arlington and National Preparedness Months.
Thank you, Jessica. Next slide. All right, so in terms of overall financials, the change from FY24 to FY25 is modest. A 2% increase on expenses and the revenue decrease due to changes in our Urban Areas Security Initiative grant funding is our biggest takeaway. Is this budget allows us to keep doing our core services. In terms of grant funding, we are starting to see a change in the emergency management grant industry. The grant funds in response to 9/11 have been in jurisdictional budgets for over 20 years. The federal funding is changing in this area and becoming more available on projects in terms of things like climate solutions, energy resiliency, and cybersecurity. And by continuing our staffing under county funding, we are now able to be nimble in looking for those funds. Next slide. While we are continuing our core services, we do have some slight reductions to our budget, totaling just over $240,000. The reduction to our computer-aided dispatch is an efficiency, as we are in the process of capital replacement of this system, and we're able to mitigate some of the older contracts in the process while we implement. This is one of those reductions we can claim as an efficiency gain. Our other reductions, however, to repairs and supplies will be shared across the department in all lines of business and programs. We will have to look to be more efficient in our supplies, our training, and other discretionary spending. When it comes to our main systems and operating supplies, we may not be able to keep spare items or test out new capabilities, and our redundancy may decrease a little. But we will never sacrifice safety and security for sure. But an example may be not keeping a ready supply of extra radios in the event of something breaks, or not testing the capability on a new component of the 911 system until we have appropriate capital dollars. Next slide. And finally, as we head into FY 2025 and we start to plan for FY 2026 and beyond, which we do because of our long-range planning, we know the future is changing in emergency communications and emergency management, and perhaps rapidly. But that also presents an opportunity. AI is here. And you guys know that we have already used AI, and we were one of the first in the nation in our 911 center to use that. And we must continue to use it and not fear it in our work. It is already leveraging so much and can do more, especially when staffing becomes harder to come by. Other technology will continue to shape our near-term future, as mentioned around call handling protocols and updates to mission-critical systems. We also continue to improve annually on our situational awareness intelligence unit and the value of the information they provide to the public safety partners. We have spent a lot of time talking about the 24/7, 365 nature of the whole department, and we see that in emergencies we face with more regularity. We now see events happening within events with coordination with a myriad of partners. This is now becoming the norm, and we will continue to train, exercise, and adapt to meet those challenges. So with that, I want to thank you for your time today, and I, along with my team, will now take questions.
Thank you. Thank you very much. Your award-winning team. You forgot to say it that time. I heard that, which is great. Questions, colleagues? Who would like to start us off? I'll look for lights.
I can
Mr.
start.
DeFranti. No, sorry, Mr. DeFranti beat you to it on the light. Go ahead, Matt.
This is not a reflection on the team or the presentation, but I asked a lot of questions on the Sheriff's Department. No questions, Your Honor. I'm going to email you a question and follow up that way, but we got to get out of here before 7:30.
Actually, by 6, I hope.
Yes.
Just
But I
let.
will email you.
Okay, great. Takis.
Very short. Thank you for all this, for the thorough work and for and well-deserved all the recognitions. The issue with I'm grappling with is this the fact that Arlington Alert is stuck at 15% of the population, and so we have also a transient population. We cycle through maybe 7-8% of the population every year, yet we don't see the needle moving at all. How do we digest that?
It's on. Yeah, the national average is anywhere between 3% and 8%, so we're well above that, but we understand that there is work that we want to do. I think the other thing that maybe differentiates us with other jurisdictions is that we actually purge our data every 6 months, so making sure that things, members that are inactive get off of the system as well. But we do agree. I think that there is room for that. I mean, we've done substantial work year-round to deliver through community events. This is how you can stay connected with us, sign up for Arlington Alert. We've worked with AED and the Chamber of Commerce to deliver it to businesses here. In April, we're going to be going to the Pentagon to ensure that we can have, employees there sign up to receive Arlington Alerts. So we are making a concerted effort. I do think that there's room for more, and it's definitely a focus for us in this next year.
Are we allowed to push notifications?
Yeah, reverse 911. I think we have that.
For that reason? So once a year, for example, we would just.
So Reverse 911 is a proprietary name. What we do now is we use our wireless alert. Your silver alert and your amber alerts, we have access to that system, so you don't have to be signed up for Arlington Alert. So we have other ways to do that, but with our Arlington Alert, it's like if you want to sign up and get traffic information, which I suggest, it's a good tool to use. And like Jessica said, we're working on it, and you nailed it. You said it. We have a transient population. Depending on how things happen in November, a lot of those people who work in DC right now could be moving out in January, and those people just leave, and then you have the same people moving in, about the same numbers. So we usually end up there, but like you said, we are probably higher than most in the country.
I was recently in Texas, Arlington, Texas. So, and they had a pilot of teaching one of the digital assistants, the name of which begins with A and ends with A skill. And you ask for the weather, for example, and they add, in addition to that, and you can also sign up for alerts, etc. Since we have the mothership here, we may be able to do something.
Mr. Carantonis actually stole my question, which was going to be about Arlington Alert as well. Yeah, I mean, I would be interested in how we get more people signed up and involved, and maybe part of that is also thinking about the types of things we push out and whether there's other information people are interested in receiving that kind of way. I know I find the weather alerts most helpful and interesting when we have major inclement weather, but I'm not sure people really know kind of what they would get if they did sign up. I know that that's something I run into a lot with my friends when I'm like, oh, you should sign up for this. They're like, why? But my question was basically how we get more people involved and signed up, and it sounds like you mostly answered.
We've mostly answered, and I don't want to, jump ahead and preview the exciting highlights for next year's budget presentation. But I would also note that people, myself included, are fairly lazy. It's tough to sign up for Arlington Alert, but it's really easy to hit a follow button on Twitter. And so our communications team has done a fantastic job pushing that. So while we've seen a 1% to 5% quarterly growth across Arlington Alert on the Everbridge platform, we've seen anywhere from 7% to 10% on social media. So that's fantastic. quick. And then we've got a couple of plans to encourage enrollment in the works now. The first is a Spanish language pilot. That's tough because if we're messaging people in Spanish, there's the anticipation that we'll be able to reply. So we're using a data-driven approach to identify the categories that are most common for us to send alerts, working with our Spanish language staff as well as licensed translation companies to be able to develop templates and to pilot out our subscriber rate across really controlled areas to see what that looks like. And then also working with our 10-miler, 9/11 5K, and Marine Corps marathon races for opt-in alerting buckets. We realize people visit Arlington. They're not necessarily here to stay. But when they do come, it's for major events like that. So in part of our race promotional materials, it'll say, do you want to know what's happening? Is the race delayed for a lightning storm? Text this number. You'll get race-specific traffic and weather alerts. And at the end of the race, we'll purge you from our rolls.
I will say one last thing. We hired an excellent communications manager, and she's already discussing with Everbridge on ways to streamline the sign-up process, because that could also be a challenge as well. It's pretty, I would say it's a bit aged the way that they do it. It's pretty challenging. So we're trying to look at every different aspect of how to make it easier to sign up, while also, expanding our reach in terms of translations.
This is great. I always used to be the one asking that question. I'm so pleased to have other people asking it. I think it was 11% then, so we're doing better. This is great. Susan.
Could you shared that it's really challenging for all of our local jurisdictions to meet the kind of national standards for call processing time. Can you say more about what the standards are and how far off we are?
So the National Emergency Number Association, which is a governing body, not a governing body, they set standards for 911 throughout the nation, does have a standard of call answering within 15 seconds. So 90% of your 911 calls have to be answered within 15 seconds. We're currently at 86%.
Great. And is there any pattern to the ones that we're having trouble answering? Is it language? Is it location, time of day?
I don't have specific data on that. What I will say is when events occur, large events that a lot of people are traversing through, such as a vehicle accident on, let's say, a large roadway, that creates an influx of calls to the 911 center, which then increases our ability to answer those within 15 seconds because all lines become busy. So, we think that that's part of the problem. I think moving forward as we implement protocols, that'll allow for a standard set of questions and for us to get the information needed quickly right away and get off the call onto the next one.
Got it. And I know coordination with our surrounding jurisdictions is an opportunity and a challenge. Can you say a little bit about how we invest in that? So if you have an accident on a bridge or you're on a parkway at the Pentagon, that the right help gets to you?
Yeah, excellent question. So within the community and the National Capital Region, we meet monthly at the COG, obviously, but through that, we have, through the fire department, the fire chief, the police chief, we share data through our CAD system, our computer-aided dispatch system, to our surrounding jurisdictions, so that it's much easier, much faster than a phone call to share that data to assess where the closest responding unit is. It might not be an Arlington County fire truck. It might be Fairfax. It might be Alexandria. So that data is shared seamlessly through what's called the CAD to CAD program.
If I could just interject, I want Jake, because we talked about this a little bit, the challenge, we see it still, but someone calling 911 and how the call is processed by a call tower and where they might, that's part of the question.
So as part of the nation's upgrade to next generation 911, federal legislation has required cell phone carriers to route 911 calls by the GPS location of the cell phone. That has occurred in 2 cellular carriers through our testing that we know of, and the rest of the cellular carriers have until 2026 to abide by that law. So 90% of our phone calls, our cellular phone calls that come into the center, are still routed through old technology, and that's a triangulation between cell phone towers. So it takes 3 cell phone towers, and it triangulates the means of that. Moving forward, after 2026, all cell phone carriers will route their 911 calls by GPS location, which will much more efficiently route that call. So today, Alexandria, especially on borders surrounding Arlington, or Alexandria might take the 911 call because it believes that that call's in Alexandria, or Fairfax, vice versa. And we're working on what's called no-call transfer. So through CAD to CAD, they will just continue to take that 911 call and pass that data off to us.
And do all the jurisdictions have the CAD access, or are there some missing parts?
Jurisdictions within the National Capital Region, with the exception of Washington, D.C.
So how do we navigate that challenging exception?
They have elected to not participate in that right now.
So it's phone calls?
Yes.
Okay. And there's nothing more we can do to be supportive on that, I suspect.
I do know through the Council of Governance, we meet monthly. We continue to have those conversations and share successful outcomes with that, and I know that they're looking at it.
Well, I would encourage you to keep talking about this because I think it's disappointing that the nation's capital isn't participating in that, so.
Isn't there a Post article in the last?
Yes.
Yeah. I had one other question, but the manager's passion interrupted it. I know what it was. Last one, I know, poor chair is wanting me to stop talking. If you're overwhelmed in the event of a home explosion or something else, theoretically, where people are calling because they all heard something, does it roll to, like, do we back each other up? Does it roll to an adjacent 911
Not
community?
currently, and I'm not sure that that ever will be we're definitely working on to see what will work best. But each center is also strapped for employees as well and influx of calls. What I will say is, yes, when an event like that happens, it quickly overcomes the 911 center, and you go into what's called a queue. And that queue will tell you that all 911 telecommunicators are busy. Please stay on the line. We ask that you stay on the line because we answer those in the order in which they were received. If you hang up before we're able to answer that call or service that call, we have to call you back. If we don't get an answer back, we could send a police officer out to that area to find out if you actually needed help or not. So what I will say is, yes, we would quickly become overwhelmed when events like that happen. That's throughout the nation. But stay on the line if you've already dialed 911.
Thank you. Actually, my colleagues have been pretty quick. Got 5 minutes. I've got a little time. So, a couple of questions. Thank you. Yeah, dangerous. Could I have a little more information, not here, not now, but in writing on what the district is not, how they're not participating? Because I'm developing friendships and networks with EPC. I've got some friends on the DC City Council. They're good folks. I bet they don't know. Or they know when they've got some issues. Well, we could, yeah, they may know, but I would like to talk to them about it. So I'd love to have a little more information, kind of talk knowledgeably, if that's okay. And I think it would be good for the EPC maybe to pick it up. We'll see. I had a question on, the Amazon Connect. So I think that gets at the issue. In the past, we've had issues with 911 getting calls from people like, I'm lost from Indiana and I don't know where I am, or that have nothing to do with an emergency. And I think this is to help siphon those off. Is that working? How's that?
Well, it's not necessary for that. If you called 911 today, and obviously for the foreseeable future, far beyond my career, you will not get Amazon Connect answering that call. 911 calls, you need a human to answer that call and listen to voice inflection, listen to the background. We take 3 times as many non-emergency calls on our non-emergency line than we do 911. And a lot of times it is stuff like that, or through the police department online reporting. You can report some crimes online. Towing is a big one for us. Where did my car go? Has it been towed? All of that information is stored on the county website. It's I won't say it's hard to find, but when you're looking for that,
When you're panicked and you can't find your car,
it's
right.
not, you don't want to go through this website and
Right.
find us. So they call us.
Yeah.
We utilize Amazon Connect to get them the quickest information by texting that information to their cell phone.
Okay, all right, cool. Well, I'm glad we're sort of starting to address that because I know that's a concern. Ms. Wynant, thank you for coming to that session with us at COG. That was great. I noticed on, which I'm sure this isn't going to surprise you, your priorities. So the issue of an energy disruption's not there. I'm hoping, which I've talked with my colleagues a little bit, I'm hoping we can have some kind of exercise tabletop with our colleagues that a little bit is like what we went through. And, when you're talking, Mr. Flagler, I think it was about, we're training and you actually, which is great. And I know all the time, that's what the professionals do. The people who don't train and exercise are the people we serve. And we've got some things, and I would love for us to find some way to kind of involve the community more. At one point, we did disaster relief trials. Were you here for that, Hannah? I can't remember.
It was my very first year.
It was your very first year. Yeah, it was fun, wasn't it? I think that's right. I think that's when I met you. Yes. I just think we need to find a way to get people to participate and think through these, and I'm not quite sure what it is, and I would love to be able to do it before the presidential election in November, just to have people kind of ready. And I think folks are, everybody's kind of thinking and worrying. I think that's why they're and I think looking for some things to do. So I think that would be great. And then I noticed one more thing on the pyramid on slide 7, which is great, your operational support and strategic, and we've got laws, policies, and regulations. Yes, that's the county board and the manager, but back to these emergencies, I think we can be helpful probably with communication somehow, and I think that's why I'd like to do some training actually for the board too, so in an emergency, we know what to do too. And I think we generally know in many ways, in fact, I'll tell the public, we need to stay out of your way. But I think we can be very helpful with communication thing. I think if you give us something to do, I think that would be helpful, and I think we could be helpful.
I think you'll find out on May 1st, the exercise, or what is the actual
It
date
is
of
in
that?
June, I think, with schools.
Yeah, so we'll
Yep.
have more information on that in
Oh,
June.
good.
It's already planned for you.
That is wonderful. That's great. I'm looking forward to it. Thank you. All right, I think that's it. Thank you all so very much. All right, 3 award-winning. All right, that's the bar now. See if somebody can come in with 4. Thank you. Yeah, give them a hand. Thank you all. All right. Colleagues, next we have up Arlington County Fire Department. There we go. Good afternoon. Nice to see you. Hello. Hello. All right, I have to turn it over to the manager. He has to introduce you. There's this whole protocol thing. Mark.
Yes, I'd like to introduce the fire chief.
In years past, you used to do these adjectives.
I used to, I don't try to do it every year. I used to do adjectives, and then I did some poems one year, but this year we're just,
Yeah.
we got some feedback from the community, try to get to business. Yeah, you have missed out, but hang out for the next few years, you never know.
He's good at puns, too. That's another thing. All right, thank you. Take it away.
Good afternoon. I'm David Pavlitz, Fire Chief. Madam Chair, members of the board, thank you very much for this opportunity for us to talk about the department. I look forward to this interaction, this budget. I'm glad to talk about the fire department, glad to talk about what we've done and where we're going, and also ask for your help and support and thanks. Next slide. So title slide serves our mission. We serve the community with compassion and an all-hands response, and also focusing on prevention. The background of this slide is Station 10, newest station serving Roslyn. Interesting and excellent fit in the community. We really enjoy working with it. It's a great, excellent build. But we're also very excited for our next station, which will be the new Station 8 on Langston Boulevard. That construction is proceeding very quickly, and we're very pleased with the quality of that. We should be occupying that maybe in a few weeks or a couple months, and then we would like to celebrate that opening within the community. Thank you for your support, as we've asked for several upgrades, and that is really, I'm going to say, you're going to be very proud of that station. It's a great fit for the community. We'll be able to respond well in a very safe posture, and it's a really good, reflective, and honorable fit for the community. I would like to introduce a lot of our staff in the room: Assistant Chief Jason Jenkins, Fiscal Officer Megan Carney. We also have Deputy Chief Tiffany Wesley. She also leads our Fire Prevention Office, and our Captain Rob Bowen is our Community Risk Reduction Officer. And I have seen Local 2800 IAF President Brian Lynch and Lieutenant Anthony Barr. So thanks for joining us. Next slide, please. Quick overview of the department: 9 stations, approximately 350 responders, and also 25 support staff. Our primary focus is to prevent that emergency or 911 call through fire prevention, through injury or medical condition prevention. We want to see if we can get the public to help themselves, and let's not have that 911 call happen. When it does happen, we have probably some of the best competent, compassionate, and capable responders that I've ever seen. We're a very strong department. We have a good mix of experience and new personnel in the department, and they do a fantastic job day in, day out. Ranging from just helping someone get back into the bed if they've fallen out and just need a little bit of a help or assistance, to very complex incidents, and like we saw on the title slide, house explosion in North Burlington Avenue. We're very cognizant and aware of the risks that we face. They're all cumulative over a career. We want to do everything we can to help our responders manage that and keep them ready, keep them safe, keep them healthy, and keep full staffed, and that's going to be a center point of our presentation moving forward. We also are very focused on providing equitable services. It goes a little bit more than just making sure we have the right station in the right place with the right units and the right people. It's also trying to find alternative ways to do that. We're becoming busier and busier every year, just as all public safety departments in the region and also in the county. We're doing everything we can to find other novel ways to provide alternate services, and instead of the routine model of just dispatch, meet, treat, transport the patient to the hospital, and we'll be profiling that in just a moment. And we talked about making sure we have healthy and safe and fit firefighters and medics, officers and responders, drivers and special operators. That goes by maintaining a high level of training and also making sure we have the right health and wellness support. And we're very happy with the stand-up of the Public Safety Wellness Office. They're off to a great start. They're integrating in all departments, and they're making the programmatic changes we're going to need to make sure we have a long and productive careers. And regional preparedness. I think we talked about this a little bit with Department of Public Safety, Communications, Emergency Management. We rely on automatic aid. We have to be integrated with all of our response partners, north, south, east, and west. We are doing that and making adjustments on a daily basis, and we're doing everything we can to make sure we efficiently and effectively provide emergency services to Arlingtonians, visitors, but also to our surrounding neighbors as needed. And if there's a large event, we'll flow out, they'll flow in. The system has worked, and we refine it year after year, and it's functioning pretty well, but we do have some good opportunities for some advancements and some improvements. And also, we have an excellent relationship internally with all of our public safety partners, Sheriff Office, Department of Public Safety, Communications, and Emergency Management, and the Police Department and all the core departments in the county. We work well. It's professionally and personally a pleasure to work with each of the chiefs, and we have excellent relationships up and down, top to bottom, through the street, all the way into their offices. It's very impressive, and it serves everybody well. Next slide. Quick summary on this presentation. Some of the changes and adjustments we're going to be profiling in just a moment. We are standing up a new Office of Professional Standards. I'll get to the details in a little bit, but it's modeled after the Police Department's Office of Professional Responsibility, and that'll help us with compliance audits and investigations, and it'll just give us a lot of additional support on the administrative side. We are also increasing through technology and also capability of our prevention office. We are doing everything we can to reduce the risk in the community, focusing on what we can do in terms of commercial properties, reducing that fire risk through building inspections, early alerting and detection, and also co-compliance, and also educating those in residents with public education to make sure they don't have a fire, but they also have the proper knowledge skills to either put it out or, most importantly, escape. We're also going to talk about some of the continuation of some of our novel emergency medical services practices. We're going to evolve that. We did a pilot program with the Center of Medicaid Services that changed. We're going to kind of pivot with that, but we're going to continue some of those core programs because it's a good, equitable delivery of service, and it gives Arlingtonians in need of lower acuity emergencies an option for other alternative forms of care. And we'll talk about accreditation and some of the progress we've made. Very excited about that, and that's going to really improve all of our operational decisions and also our administrative functions over the next several years. It's a very high bar to make, but we're off to a very good start, and we'll give a progress report on that in just a moment. Next slide, please. Equity, community equity. Like I say, public education, community equity is a very important focus of ours. We are partnership with Arlington Public Schools, Virginia Hospital Center, and we deliver hands to hearts to 9th, 10th, 11th, and 12th graders in the high school system, and that's an excellent partnership. Also the faculty, I think we were at Yorktown High maybe 2 or 3 weeks ago, and we'll continue with Wakefield. If we have an invitation to come in, we will make sure our teams are there, and that makes a difference. If we can get these core life skills or life-saving skills into our youth's hands, they're going home and they may have that emergency, and then they'll have the training experience and maybe some of the muscle memory to help out some of their relatives. And that again, we've had some really good outcomes with that. Also, we're going to continue helping out all departments or all agencies in the county with the addiction and opioid crisis. We're doing everything we can to make what Narcan leave behind to see if anyone can have an additional chance of survivability. Once there's a notification, once we get there, we have some of the best life-saving skills to get them. We just need them to have a chance, and then we'll get them to the right and appropriate care. That's an excellent program. We're going to continue with partnership. We'll talk a little bit more in detail about some of the telehealth and treatment in place options in a couple of slides. We're going to continue with our internal equity to make sure we serve all well. We do incredibly brave work out in the community. We have some of the most forward individuals who would sacrifice a lot to help others. We want to make sure we maintain that sense of safety and security in non-emergency conditions at all times through the department. So working closely with human resources and developing some of the training programs we're going to deliver in this year, calendar 2024, and thankful for the manager for some of the resources that he's devoting to that here and now. We are definitely looking to make sure we make some changes moving forward, and that's just going to also extend careers and just make sure we deliver the best service to the community. Next slide, please. Output and outcome measures. I'm going to qualify some of these, but on the top output performance measures, we are increasing in terms of emergency calls, emergency incidents. We're seeing an overall total increase from 2020, and there'll be a more detailed slide. We're increasing somewhere between 4, 5, 6, 7% each year post-pandemic, making up for a little bit of the pandemic dip, but we definitely have more circulation, more people, more activity in the counties, and that also brings just more incidences. We are seeing a little bit of a moderation in total fire incidents, and we want to see that continue with increases in fire prevention services, but I think we're going to have a continual increase in emergency medical services in the years to come. And some of our outcome measures, we changed this from the prior budget presentations over the last several years. This aligns more with the Center for Public Safety Excellence accreditation process, and we're going to be tracking this as we move through our accreditation process. I'll ask Chief Jenkins to maybe give a quick briefing on what some of these outcome measures mean.
Push it, yep.
There we're good.
Yeah.
Thank you, Chief. Briefly on outcome measures, they're specifically tied to the National Fire Protection Standard 1710 for resource deployment. You heard in the previous presentation about benchmarks for call processing. The fire department focuses on 1710 for turnout times, response times, time at patient, and so forth. And everything is focused on the 90th percentile. These aren't fabricated numbers, fabricated measures by any stretch. These are benchmarks. They're national standards. And as part of the accreditation process, which is another theme through some other presentations prior to ours, is opening ourselves up to criticism, third parties assessing how we do and what we do, and opportunities through efficiencies to do it better. So again, briefly, 1710 is the particular standard, specific standard on resource deployment, and the percentages that you see, there are opportunities for improvement. And later in this presentation, we'll touch on the risk assessment and standards of cover and steps we're taking to improve those percentages.
Thank you, Chief Jenkins. Now, I'm a budget nerd, so let me introduce you to Megan Carney, and she makes me look like an amateur. I'm going to cap Megan at 9.5 minutes per slide, but please take away our budget summary.
So on our summary of proposed changes, you'll see that the fire department expenses are mostly remaining the same. This is while we are increasing our normal personnel expenses and increasing for things like the job family studies. You'll see the decline from 24 to 25 due to the loss of a lot of one-time funding that we received in FY24. This was grade step bonuses due to collective bargaining and almost $1 million in one-time vehicle expenses that were in our FY24 budget. You will see that we are expecting nearly $500,000 increase in revenue. This is driven by two main factors, our increase in ambulance billing revenue, and that increases with the number of incidents. So as incidents go up, often our ambulance billing will also be expected to increase in revenue there. We have also implemented a new inspections and systems testing software. We started that in November of of 23. And that system allows us to increase efficiencies in having third parties do the inspections and pay us a fee. This allows not only increased revenue, but also increased number of building inspections and prevents our inspectors from having to go on scene, so we can see more buildings. Our staff, total FTE count remains the same at 371. We are losing 3 FTEs. These are temporary FTEs we'll talk about in the decline of the ET3 program. It's equivalent of our 7 temporary employees that were part of that program, but we are gaining 3 permanent FTEs, 2 for the Office of Professional Standards that we'll talk about in a minute, and 1 for a qualified healthcare professional, which is part of the Treat No Transfer program that is replacing the ET3 program.
Thank you, Megan. Megan hit the ground running with a lot of help from our partners in DMF. They've been fantastic helping us do a little bit of a transition this past year. So on the first budget change, the Office of Professional Standards, Megan, we just profile the first segment, and then I'll talk about the function.
So yes, we are including 2 FTEs to run the Office of Professional Standards. These are the estimated salaries for the 2 positions, a Professional Standards Quality Officer or Quality Assurance Manager, and a Senior Managerial Analyst that will serve as a Compliance Manager reporting to that position.
And this office will help us on administrative functions in terms of complying with laws, regulations, collective bargaining agreement, and also our internal policies. We'll also have an internal audit element in it, and it will also help with investigations. Appreciate the manager providing support this fiscal year, and we should be onboarding the first professional standards officer probably in about 2 or 3 months. So we're well in progress, and then the next senior management analyst will be in FY25. Next, treatment and no transfer in ET3. I'll ask Megan to go ahead and profile the first table, and then I'll ask Chief Jenkins to take it from there.
So in the past couple of years, the department has been part of the ET3 program, which is a Center for Medicaid program that allowed us to bill for patients that received treatment from us, but we did not transport them to the hospital. Therefore, they didn't enter our ambulance billing program. Because the federal government is ceasing that program due to just general national non-use, the Arlington County Fire Department has decided to do a Treat No Transfer billing program. So where we are treating patients on the scene, not transferring for them, we will implement a new fee and collect revenue to curb our costs for that program. The important thing to remember here is that we will be billing third-party payers only. It will be only for insurance agents, for insurance companies, and we will not be billing Medicare or Medicaid patients.
And in addition to Megan's explanation of where we were and where we're going, it's, again, in the spirit of adapting. The federal government took away this initiative, but we in turn assessed where we are, we assessed the community and the needs associated with it, and we've adapted. And having a healthcare professional available provides additional opportunities in addition to Dr. Smith, in addition to telehealth. It's, again, diversion. It's alternative destination if appropriate, and if not, leaving the individual where they are and still having the ability to capture revenue by way of a third party through their insurance. So again, it's doing right by all entities, both the department, the county, as well as the individual.
Thank you, Megan and Chief Jenkins. Next slide. So one of the budget reductions impacts Camp Heat, although I think we might be able to do something as an alternative. So Camp Heat, long-established program, probably 10 or 15 years running, engagement with the, I'm going to say, younger high school, started with young women in the 10th, 11th, and 12th grade, and then we opened it up to just all probably 10th and 11th and 12th graders over the last 2 or 3 years. Excellent week-long program, but it's very expensive, very intensive, And I think we're going to be able to do something similar as we've reached out to Parks and Recreations and also the Police Department and see if we can join some of their existing programs with a focus on teaching some of the either high schoolers or maybe even younger crowd some of the aspects and what they can do to help in terms of fire prevention and maybe point a career towards fire rescue and EMS. Next slide, please. So key budget considerations for the future are one of our, we share the same with all of our public safety partners. Our staffing, our first responders are our most important asset, and we want to make sure we retain, we want to make sure we bring in the best who could serve the community and also the fire department. We are in a hyper-competitive environment. It's very similar to what everyone, police, sheriff, and everyone is facing, and we are, I'm going to say we, the fire service, probably enjoyed a little bit of a longer period of robust labor pool or interest to come into the department. That's kind of changed over the last, say, year or two. The fire service in general is now facing extreme shortages in all of their application process, recruiting process, and it's hyper-competitive in the region because we are moving into the age of laterals in fire rescue and EMS. I think that's been present with law enforcement for quite a while. Now all of our surrounding jurisdictions are starting lateral programs to bring someone over in a shorter academy class, and we are going to do the same thing this fiscal year. So we kind of have to level up, and we also have ideas to make our process a little unique and very attractive, but it's extremely important, very, very important to make sure we retain some of the core talent we already have in terms of recruit classes the last 2 or 3 years to someone who's served the department for the last 30. We've invested in them. They're some of our best firefighters, medics, drivers, special operators, and officers. We want to make sure they have a long, healthy career with all of our health and safety programs, but also maintain competitiveness within the region. As we see all of our partners start getting their first contracts and what their compensation looks like over the next several years, we're going to have to address that in probably similar fashion. So we want to make sure we maintain fair and equitable compensation, and also want to make sure we give them the best stations, equipment, vehicles, and policies and procedures to work from. We want to keep them here in Arlington because I'm going to be very forward on this. There's probably every single department in this region would love to poach an Arlington firefighter, medic, or an officer, and we're going to see this probably increase throughout the years. We're also very, very aware of the demand on all of our responders in terms of overtime and mandatory holds. It's been increasing throughout the years. We have a probably lower level or higher level of vacancy than we've had in many, many years running. We are probably 25, 27, 28 positions under our authorized staffing. We want to see if we can bring that up with our next recruit class and also the lateral program. We need to be fully staffed so we can let people go home. We have to maintain minimum staffing of 77, 78, 79 people per shift, and we want to make sure they have the ability to go home. They put in an incredible, intense, and very focused 24 hours. We want to make sure we kind of hold it at that unless it's voluntary overtime. We are also a very lean department. If you look at us comparative to many other departments in the region, we have probably more staff and personnel in the stations, in the street. We do an incredible amount of who we have in all of our offices, but what we do with 1 or 2 people, other departments are doing with 4, 5, and 6. Our output is extremely high. So we want to make sure we maintain good, available, and healthy workforce. That's our #1 priority in this competitive environment. We're also focused on, and I think it's coming up in 1 or 2 slides, some of the areas in the county that's going to need additional emergency services over the next several years, and I'll focus in on west end of the Columbia Pike in just a moment. We'll talk about accreditation, expand on that in more detail, and we need to continue our ongoing investments, and I'll talk about how we're doing more with the same amount of people, but using a lot of technology to assist. So staffing, kind of they lead into staffing. So the top right chart, the bar chart is our vacancies year over year. We were trending down for the last 5 up until last year, calendar year 2023, where we saw probably twice the normal attrition rate for a variety of reasons. There was a definite spike. So we're now trying to recover from that, and if we probably seat a recruit class of 25 to 28 to 30 a year, which has kind of generally sustained us, we're probably going to have a lower number of that to start. So we're going to have to compensate for that in terms of a lateral class. We need to return to full staffing. We do have lower than expected normal retirements over in this calendar year 2024 and calendar year 2025. That's a little bit of a help with the labor contract fourth year in the drop. We kind of push those retirements off and we can retain some of those top leaders and top officers. Then we need to kind of normalize and get back into a better pattern where we basically match our attrition rate with who we bring in. On overtime, we have a very keen focus on overtime. We're doing everything we can to reduce those overtime levels, and one of the hardest form of overtime is that mandatory overtime. We want to reduce that. We kind of see spikes throughout the year, but we know we're going to have or get into a busy season where we move into a leave usage period. We want people to go home, have a vacation, get away with their family and friends. They deserve that, but that also takes away some of the availability. So we moderate our activities. We're doing everything we can in terms of management controls to moderate our activities and push as much as we can into when we have a lot of people working, but sometimes it's unavoidable. We have to either through training activities or programs, such as we're starting it's the first local paramedic program for the region in George Washington University, and we're hosting it in Boston for this next 2 weeks. It's in partnership with a lot of the District of Columbia and also a couple of Virginia departments. It's a great accelerated program, 38 weeks instead of probably 18 months to get a ALS provider, a medic who is a critical responder in our system. That's a great compressed time frame, but we're putting a lot of people as we possibly can in here and now, so it's going to create some staffing pressures. So we're moderating as much as we can and doing everything we can within our control to make sure we get people home, and we'll continue to do that. We've had modest improvements, probably year over year over the last 2, modest reduction, but every holdover is one holdover too many. We need to get everybody home. We also are experiencing right here, right now, 25 vacancies, and that's also compounding the program. So it's going to take a little bit for us to train everybody, get back to full staffing. We want to get there as quickly as we can. Next slide, please. This one's a little difficult, but I'll be able to verbalize the bar chart. The bar chart is cumulative 5 years of incidents in particular areas or units responding from stations. Our busiest area, is the top of the peak of the chart, is Station 5. That's in the National Landing, Pentagon, and Crystal City area. And then we have Station 2 is pretty much the next or second highest chart. That's in the Boston region. And then South Glebe Road in the center of the county, and Roslyn area, Station 110 and Station 1. And then we also have Station 9, serving Green Valley and Shirlington. Those are our top 5 stations. They're very busy, and they're closely aligned with the population centers. That's where we're going to see the most calls. We also have a portion of West End of Columbia Pike, and that's primarily served by a Fairfax station, Station 410 out of Fairfax County. And that's where we're looking in the future to make an investment through the capital improvement program to see if we can place a station there, because that station is basically our sixth busiest station, our busiest area that is pretty much provided service by or from Fairfax County. We are very coordinated within the region. We want to make sure, and we're also looking at and engaging the District of Columbia. We're having some very preliminary conversations to start synchronizing our operations. We already have integrated and interoperable communications, and we're working with them as we progress through some technologies to make sure, or to see if we can effectively start crossing the bridges in a very limited manner. We can help them, they can help us, but we're taking very cautious steps because our systems operate in very different procedures, but it's something I think we can address over the next 1 or 2 years. Next slide, please, and I'll turn it over to Chief Jenkins to talk about accreditation.
So for several slides, we've touched on accreditation. We'll go a little deeper here. And during last budget proposal, we touched on accreditation and where we were going. Now it's where are we? We have completed our draft strategic plan, which focuses on and provides a roadmap for 2024 through 2029. We completed that recently, and it's now time to take steps toward the second pillar, which will be our community risk assessment, which informs our standards of cover. For several slides, we've touched on call volume, different parts of the county being busier than others dependent on the day of the week and the time of the day. The community risk assessment takes a deep dive, an assessment into each particular area and looks at population, looks at density per time of day, socioeconomic status, transportation, weather, call volume, and types of calls in that particular area, and then feeds the standards of cover, which takes a look at where are our facilities located, the resources within the facility and the human capital on that particular piece of apparatus. All that being said, this again, none of this is fabricated. This is a third party, the Center for Public Safety Excellence and fire accreditation, the benchmarks, all the standards originate from the National Fire Protection Association. The law enforcement arena is familiar with CALEA. For fire and EMS, it's CFAI. These are the standards that we will be measured against. And if we're unable to meet the standard, we have opportunities ahead of us of how we can do better in an attempt to meet the standard. In a 90th percentile, no department is expected to be perfect, but we strive for excellence. That's why the entire accreditation process is focused on continuous quality improvement, seeking efficiencies, and ensuring that apparatus and the human capital, all the specialized providers that we have, are in the right area to maximize our opportunity to meet our response times. Again, we've completed our strategic plan. The next pillar is our risk assessment standards of cover that we will focus on throughout the remainder of this calendar year. High hopes that we will complete this endeavor by Thanksgiving before we enter into our self-assessment, which is really all facets of the fire department. And the goals that we have set to date focus on community engagement, internal communication, workforce analysis, resource deployment, as well as the accreditation process itself, and not to mention training. There are various 7 separate aspects of training which will become the heaviest goal of all 7 goals within our strategic plan. But as we begin to self-assess, we're again measured against performance indicators that we do not create. CPSC, CFAI create the 11 categories and over 250 performance indicators that we will be measured against. We know we will have gaps. It's understood, but we will be forced to establish a plan in an attempt to meet the performance indicator. So again, it's opening ourselves up. It's showing humility for where we are strong and where we have gaps, and that we will be better, and we're continually seeking professional excellence.
Thank you, Chief. And to summarize our activities from this past fiscal year moving into the next, we're going to continue to work through the first year of our collective bargaining agreement. We have extensive interaction with Local 2800 on many, many fronts. We're very proud of the health and safety initiatives that we agreed to, and we're also improving for the whole entire department. We also, as we discussed, we're very excited as we move through the accreditation process. It's a heavy lift, but I think we have the people, the right team, and the willingness to do it in the department. I mentioned technology. We are very integrated, and we rely on the Department of Technology Services and Public Safety, IT, to help us. We need their support. We need their systems, and we're bringing more and more online every day. And some of it's really interesting, cutting edge. We're testing and piloting a few things that will help out responder safety in terms of first responder localization to make sure we know where we are at all times, and through just the administrative, trying to bring in some of the artificial intelligence and machine learning. So we need that to make sure we keep it working efficiently. As we talk about some of our training activities, we're doing a lot of regional training with the George Washington University ALS program. And also, we're talking about partnering with Alexandria, former fire chief, and also Deputy County Manager Jim Schwartz. I meet him frequently, and we are coordinating and talking about sharing things in terms of some hiring, the candidate physical aptitude test, and also the training opportunities that would benefit both Alexandria and also Arlington. So that's interesting. And we're going to continue with our health and wellness. We're very cognizant, and this is also addressed in the collective bargaining agreement and our focus on our health and safety teams on cancer reduction. We are exposed to many carcinogens in emergency situations, but also it's unfortunately some of those forever chemicals, PFAS chemicals, are in our protective gear. That protects us from more acute hazards in terms of thermal injury and kinetic injury, but it's also possible a potential carcinogen. Encouraging news coming out of some labs that looks like there may be some other barrier fabrics and garments that may be acceptable, provide that same level. We will be ready to make sure we have the right fiscal resources at that particular time to see if we can upgrade our equipment and reduce our exposure. And we do that also through fleet design, our apparatus, policy and procedure, and station design, very focused on reducing and eliminating cancer exposure. And we'll close on community risk reduction. As we are very proud of our response capabilities, we would like to reduce or zero that out. We are going to focus on making sure Arlington remains safe and secure in as many ways as we possibly can, through education, through system code enforcement, and building and system design. And we just want to make sure everyone can thrive, all visitors and residents in Arlington can thrive in a safe environment.
Thank you.
Thank you.
Yeah, thank you. All right, colleagues, questions? And for the left, Ms. Coffey. Start us off.
Fastest to the button today. Okay, so I'll start with one of the things that you mentioned when it came to staffing is that we do a lot with less here, including, having 2 to 3 firefighters when others might run 4 to 6. Is that safe for the community and also for our firefighters?
We have some of the highest levels of staffing on our units. We're very proud of that. While other jurisdictions, other environments may run less, they may run 3 people on an engine company. In more of maybe a rural area, we are a urban and very dense suburban department. We have 4 personnel on ladder trucks, 3 personnel on engines, 3 personnel on all of our heavy rescue companies, and also our medic units have 2. We are probably at the standard. Some larger municipalities, such as New York, may run more people, but we are probably where a lot of departments would like to be. So we have emergency services in the streets, on the stations, are robustly staffed. Yes,
Okay,
ma'am.
thank you.
Thank you.
And then on the treat no transfer program, I know you're saying billing third-party payers, but what about folks who are uninsured or underinsured?
They will not be billed.
At all?
Only insurance companies.
Okay, thank you. I think those are my 2 questions.
Okay, great. Mr. DeFranti. Matt.
Thank you, Madam Chair. Really appreciate the work on accreditation, on professional standards. I also am glad to hear, because of the potential, particularly because of the potential for reduced holdovers of the lateral suggestion on our vacancy rate, mindful that that overtime reduction will help those who are already here. And so that sounds like a good direction. I'm sure there are details that I could learn. Can you give me a little context on the 4-minute response time and the 90%? Because I do know that some rural fire departments in Texas don't come close to 4 minutes, but because I used to work with some of them, but how do we stand regionally compared to other people? I also know that, if you ask the social workers, how many social workers should be in a school, they would say a lot more than we have, for example. And so, but it is, every second can make a difference on a stroke or a heart attack. And so can you give me a little context on the 53% versus, I like the 60 and 80 second. Those are important metrics, and I don't know them as well, but I do know that getting to someone fast can make a difference. And I don't want to jump to any conclusions, but I'm just curious, both the efforts to get closer and then where we stand vis-a-vis other Northern Virginia and DC type.
Yes, sir. This is a complex topic, and to work through the risk assessment and standards of cover, which is really the crux of what you're discussing right now, it's rigorous, all right? And we'll start with our minimum safe staffing is 4 on all of our heavy apparatus. Why? NFPA 1710, for safe staffing and resource deployment informs that. Also with that, dependent on the risk associated with within different aspects of your community, it could inform more than that. Low-risk areas, single-family dwellings inform 4 personnel on heavy apparatus. Urban, dense, city environments with complex response districts, residential over commercial, residential high-rise, commercial and so forth, informs more than 4 personnel on heavy apparatus. It's important to understand as we progress through the community risk assessment that dependent on the risk, 4, 5, or 6 personnel are required to meet NFPA 1710. So I'll start there. Your inquiry into response times, the 4-minute response time within the 90th percentile, the life of a 911 call, as heard through the previous presentation of the PSAP answering the 911 call within 15 seconds is a measurement. The caller interrogation to the point of dispatching fire and EMS is another benchmark of 90th percentile to do so in 60 seconds. The moment of response, which is now getting to your question, the response time prior to response is your turnout time. Fire and EMS turning out from the moment of dispatch to the moment wheels are rolling is 60 seconds for an EMS event, 80 seconds for a suppression event because it takes additional time to put on the PPE. Now we're through turnout, wheels are rolling. That marks the start of the response time. 4 minutes to arrive on scene of dispatched address. So while that is indeed a benchmark, a measurement, and we have 9 stations strategically placed throughout the county with resources in each, as call volume increases, it makes it more difficult to meet that response time. We have 9 strategically placed fire stations with excellent apparatus, with personnel on each. However, as call volumes increase and you have second call, third call in any one of those districts at any given time, it makes that percentile that much more difficult to reach because now responses, companies are coming from second and third due. That's why when you look at that percentage, it's becoming a challenge to meet because we've exhausted our efforts with the companies we have in place. Our personnel will make or break us, but as call volume continues to increase, as the chief touched on, 7% call volume increase year to year. Facilities remain the same, apparatus responses continue to grow. It's going to make that more challenging to meet.
Thank you, that's helpful. Without, so I wrote down here, we have a few, I don't know how we compare vacancies vis-a-vis Alexandria, Fairfax, et cetera. I do know we have a greater percentage of high-rises than all those other places. So those two might be causal in leading me to say we might not be at the top, 53% might not be at the top relative to some of the other Northern Virginia jurisdictions. Without ballpark, do you have a sense of where we are on that 4-minute measure relative to other parts of Northern Virginia? Not for blame, but for like how do we assess and how do we help?
Let me preface this with there could be a slight flaw within the percentage because there's a human element involved in this. In the perfect system, perfect world, with our new CAD system forthcoming and geo-fenced stations, at the moment that apparatus moves marks the start of the en route time, where today it's dependent on human interaction with marking en route and then marking on scene. My point in saying that is there could be outliers. I think the percentage is better than what you see. Okay. Now, as compared to our neighbors, we are, again, a densely populated area with 250,000, and with our high rises, the arrival time on scene, dependent on where a patient is, you still have your vertical response, which is captured in our at-patient time. That at-patient time is not a measurement captured through accreditation, but that is indeed a challenge for us with the influx of high-rises, what we have and what's coming. So it's on-scene time, our response time, but that's not always our at-patient time. So even as that percentage increases, we still have to be cognizant of our at-patient time. That's just as important.
Okay.
I think we can collect some of that data for comparison. It'd be a very rough comparison at this point in time, but I think we can call some of our
Yeah, I think-
neighbors. I think they have that data for the board's
I think
interest.
following up would be great. I think you've been very precise, and I appreciate that because I've seen lack of precision in places. So I really appreciate that, but I'd also love to have a context-based conversation. Thank you.
Thank you. Susan? Ms. Cunningham?
Just following up on that question, in your data, when you say percentage of emergency incidents reached within 4 minutes, that's the on-site, not outpatient. Is that right? Okay. What should we be doing the next 10 years to get those numbers to all 90%, as is the standard?
Start.
What I think Chief Jenkins started to lead into is right now we have very good coverage, but we need more in the system. And I think through the community risk assessment and standard of cover and accreditation process, we'll be making recommendations to the board for probably additional stations and units over a period of time. We kind of have a sense of it right now. This analysis will basically verify and validate that.
Great. And we know the CIP has one of those stations floating through it at various times. What would a western station on Columbia Pike do to these numbers? Do you have a sense?
It'll definitely help, and we just need additional units in the system. We'll determine what those units are, but having a fixed location, a high-density area on the west end of Columbia Pike will just help help Arlington, also help a little bit of Fairfax, helps the whole entire system.
Great. And precursor to CIP, but it sounds like that is needed several years ago, or tomorrow would be best. Is that right?
Yes, and I think I've said this before. We've had lots of conversations about fire stations, but we have to purchase this property on the west end of the Pike, and then we have to go through the process of starting to staff up at the same time we decide whether it's simply going to be a fire station there or whether it will be co-located with any other county facilities. It's a several-year planning process. We need that time and space to increase staffing. We've done that in the past, but it's probably, from the time we say go, it's a 4 to 5 year process to get a full new station online. And then after that, the chief has talked to me a lot, and the community risk assessment will look at this. With the increase in development in Pentagon City and Crystal City, you can see Station 5 has an incredible workload. We need to be looking perhaps at the east end of the Pike and making entry into Crystal City and take it from there. But these are long-term investments, require a lot of funding. But we're committed to doing it. I'm not sure if you gave us a whole bunch of money right now, we could do it much faster, given the time we need to get the system going and the staffing online.
And I know we've had temporary stations as we've rebuilt them. Is it possible to stand up a temporary station before you get all the way through that process?
We utilize temporary stations if we renovate an existing station.
Yeah.
I don't think we would, well, again, it would take the personnel, the apparatus. It's almost going to take an equal long time to get those resources ready in terms of, coincide with the facility.
I'm going to give permission to the chief to discuss what a fire department might look like 20 years from now, where we might be moving away from a station-based approach, because I know that it's going to cause everybody's head to spin, but he's given a lot of thought to that.
Yes, as technology improves through everyone's personal use of it and also jurisdictions and departments' use of it, we're going to be able to have a higher fidelity on really seeing where the incidents are at that particular point in time, space, and then we might be able to have a dynamic system where we kind of float resources or even kind of take a swarm model and get the right appropriate responders there. It may look different in 10 or, well, 5 or 10 or 20 years, but it's possible, and maybe moving away from that fixed central fire station to maybe something a little bit more diffuse, and that'll also drop down travel times and response times. It's possible, but that's something we're definitely going to take a look at. And maybe start some of the technology and infrastructure foundations now to see if we can realize it later.
Yeah. Can I ask one other section on nutrition? So there's a spike in departures, as you highlighted. Can you say how many of those left to go to other nearby jurisdictions?
Yes, plus or minus 1 or 2. We think we have, I think we know of at least 6 in calendar year 2023 that went to other departments for a variety of different reasons. Normal is about 2 to 4, so we did see an increase. That's only going to increase as other departments would love to pull our previously trained or high capable and competent responders into their departments. So there's going to be that constant tension away from us. I would say 2 of the 6 were out of the region, and 4 of the 6 were kind of in the region, sometimes aligned with other family members, but also it's the same that was mentioned earlier. If someone's living maybe 2 or 3 counties out and could drive through a county that has the same competitive benefits and similar environment, then that's going to be an attractor. We want to make sure they can make that drive, commute, and also come work with us for a variety of, we think, some of the really good reasons.
Great. And can you just say briefly for the EMTs and firefighter, how long from the time we hire them, if they're a new recruit, until they're on the street?
6 months.
For both?
6 months.
Okay.
Because we're cross-trained, both fire and EMS. The anticipated start date of our next recruit class is the first week of May, and they will graduate around Thanksgiving.
Would you add the development of an ALS provider?
And to go beyond that of a basic firefighter EMT and then educate them to the level of a paramedic using an in-house program such as our partnership currently with George Washington University. That's like a 36, 38-week program. Using other community colleges, universities, et cetera, that could extend in upwards of 18 months.
Great, thank you.
Depending on the facility.
Okay. Tagas.
Thank you. So I have to say this is always a very fascinating thing because a fascinating presentation. Thank you so much for that. Just discussing about how elastic the response of the department is in an environment that becomes more complex and more demanding, and you have like an escalation of the standard of service accordingly. That every time I have been riding with you, I had to recognize that this is literally a challenging environment that you're operating in. And this is precisely the reason why I'm very grateful that you are attempting to rationalize that through the accreditation process. So thank you for that. My topic is the issue of overtime and mandatory in general. So this year, fiscal year 23, there is a significant jump. This is slide number 12. And it correlates obviously with the with attrition that we see there, so that I can kind of intuitively digest. However, in the year before, fiscal year 22, this was also almost $8 million. So there must be more to this than just the personnel availability. So can you elaborate a little bit how you manage overtime? I understand that we now, we implemented the Kelly Day.
So Kelly Day had an impact. Well, leading up to the Kelly Day, probably 4 fiscal years leading up to Kelly Day implementation in January 2022, we were onboarding 10 people per fiscal year to get there in a probably comfortable manner, and also had the ability to train them within any given year. They were basically extra. They were offsetting overtime. The second we turned on the Kelly Day, we reduced our hourly week from 56 down to 50. That was a benefit, but then they were not available. We modeled in some overtime. I don't think we modeled probably the right overtime at that particular time. Then the pandemic hit, and we probably saw impacts to our workforce a little bit longer than the community's impact in terms of if we had an exposure, if we had or if we became infected or sick, we had a mandatory 10-day quarantine isolation. So that was pulling a lot of people out. And we did see a huge spike in calendar year October to the fall of 2022, which drove our holdovers and overtime through the roof. So we had a little bit of those increased in up pressures. It moderated a little bit in calendar year 2023, fiscal 24, but then we have a higher vacancy count. So where we thought we might reduce some of the overtime, it looked like we have just vacancy pressures. So we're doing everything we can on the system side to see if we can get efficient use of our resources, bring down overtime, and avoid mandatory holds. It's just right now, I think, two different issues really kind of impacted us. I'm hoping we can kind of come out of that and reduce it a little bit, but we basically operate off of overtime to some degree.
Is there an estimate? You know, I know that these are calendar years, and so we are just in the beginning of 2024, right? So it's tough to estimate how much pressure on overtime there will be, but have you a sense of what this looks?
Please.
For FY24, we are looking at a $10 to $11 million in overtime.
Yeah. So I recognize that as a significant challenge, to be honest. It goes up and up and up, and it is not, and I don't have a grasp of what it exactly will take. So what is the dial that needs to be torn to exact? So how many people or what's the recruitment that we have to achieve it in order to at least tame or limit the the dynamic of increase here, right?
We need to
8
return.
to 9 to 11 is.
We definitely need to return to full staffing. We bring available people within the system, then we'll be able to moderate, bring down overtime. We also have to make sure they are available to work. We do have injured firefighters, injured officers, paramedics. We need to bring that down because any injury can extend an overtime cost by 4, 6, 10 months or a year. We want to make sure we don't, through injury prevention, illness prevention, make sure they're available. So while we have structural vacancies, we probably also have some functional vacancies in terms of 15, 20, sometimes 22, 24 individuals who just can't work for a particular point in time. They're trying their best to come back. They're going to work hardening. They're doing everything they can to return to us, but sometimes it takes much longer than initially anticipated. And then management controls, make sure we schedule and bring all the things under our control that we won't incur those overtime costs.
Sorry. Thank you. And I guess accreditation will also inform us what the appropriate level of overtime is. What is the benchmark level of overtime?
Staffing, yes, sir.
Yeah.
All right, thank you. Thanks for doing the accreditation, because I can see it may not look pretty as much as you might like, but you're going to do it anyway, and I think that's great. Quick question, I'm assuming we already have drones. Do we have drones that help us? I think we do already, do we not?
Our drone program and partner with all public safety agencies, yes, we'll have the capability. It's a good joint effort, and we are very coordinated, and I think we're having, at least sounds like, and I believe Chief Penn will be talking about this in his presentation.
Okay.
We're slightly behind. We're going to have that capability for situational awareness. Yes, ma'am.
Because those seem just great. And how about robots that actually go in? I was just fascinated, the whole Notre Dame Cathedral thing. It was a robot that saved it in some ways.
We've had that similar system demonstrated in the region.
Yeah.
It's very interesting. Right now, it's kind of first generation. We would love to reduce the risk to individuals if we can put robots or anything automated ahead. We do that with our bomb team. We would definitely send those robots first under control for assessment and sometimes disarmament. We would like to see if we can start doing that in other environments, but we probably need next generation and a few more technologies.
Yeah,
and testing.
okay. Well, I think in the 5 to 10 years, it could be getting just a whole lot better. And I will just warn my colleagues, having been through a fire station, talking about moving or not, it's equally difficult putting a fire station in and taking a fire station out. So plan for a lot of time on community engagement. People get very emotional about fire stations, and probably because we depend on you all. And thank you for all you do. Mark.
I was just, and take my opportunity here. I want to talk about, get a little geeky just for a minute before you go, talk about the Z coordinate.
We are.
What is it? What is it? It's not an alien species.
Uh-huh.
XY lateral, we have very good fidelity in locating our units, and we dispatch the closest unit. We know where our units are. We know where the 911 call. The system, through technology, gets them there quickly. Z is height. Z is that third dimension. We want to see if we can capture all of our responders Z coordinate in terms of accountability, safety, strategic, and tactical deployment. With Burlington, North Burlington Street, a catastrophic event, we need to quickly know where everyone is for safety and accountability, and also any operating or any, what I'm going to say, routine emergency, whether it's in the metro tunnel, whether it's in the street, 2 a.m. or bad weather, or on the Potomac River. If we know where everyone, all of our responders are, and also through the technology and emergency communication center, know the same coordinates in 3D space where the caller is, we'll be able to help each other and get there faster.
Right.
So it's using technology to get us there quicker.
Yeah, technology can help a whole lot. I'm also waiting for a little lift, so instead of having to go up the elevator, you just get a little something that just flies you up, fights the fire. Anyway, thank you so very much for everything you do, and really pleased. We better keep moving, I think, because we've got our police coming and still more to go. But thank you for everything.
Thank you.
Really appreciate it. All right, colleagues, I'm going to stand up because we've been sitting for a little long time. I invite everybody else to stand up too if they'd like. I'm getting a little old to sit for quite so long. Sit. And then a wellness initiative summit, yeah, which is good. Yeah. You know what, it might be long enough. I'm going to actually, I'll be right back. Oh, yeah. All right, we're back. All right, everybody's had a bit of a break. Chief Penn, Chief Cassidy, Deputy Cassidy, nice to see you. Mr. Manager,
Hi,
you're
I'd like
supposed
to
introduce everybody.
Yes, introduce the Police Chief, Charles Penn.
Yeah, AKA
Right, AKA
Andy.
Andy.
Yeah.
Good afternoon, and thanks for having us. I want to start with some introduction of who's with me. I'm joined by Deputy Chiefs Darren Cassidy, Dave Giroux, Latasha Chamberlain, Wayne Vincent, our Budget Manager, Amy Costanzo, and our new Public Safety Wellness Coordinator in the back, Leslie Gear.
It's Weller back there.
Yep.
Is that a safety distance?
That's, it's a safe distance. She's near the door. Next slide, please. So I'd like to begin just by highlighting the department's key initiatives. In just a few seconds on this, these 4 initiatives guide everything that the police department does. And this applies to from me to the newest officer. And it's meant to be that all of our work every day is focused in these areas to make sure that we're doing our best to ensure public safety and that we are living up to our core services. And I'll talk about each one as we go through, but I just wanted to start with that. Next slide, please. I think it's also important to begin with recognizing how blessed we are to have such incredible staff across our agency, both sworn and civilian, who do an exceptional job every day and come in with a service attitude to try to do all we can to ensure the safety of the Arlington community. So I want to begin the presentation with a few incidents that highlight and demonstrate this commitment. The first is the home explosion on North Burlington Street that happened in December. From the beginning of this call through the explosion and follow-up work, our staff approached this with the safety of the community as a guiding priority. I could not be more proud of all the public safety employees who worked through this dangerous situation. The caring and professionalism displayed, along with the team's planning, technical expertise, decision-making, and use of equipment, led us to a result where no public safety employees or nearby residents were severely injured despite the violent explosion. In the aftermath, there were many public safety personnel who did suffer injury, but thankfully all have recovered and are back to work. The second incident I want to highlight occurred in April. It was a bank robbery where a subject entered a bank, said he had a gun, and held 5 people hostage for a period of time. When the call came in, staff from across the police department and our public safety partners were on scene in under a minute, and they worked collaboratively as one team and resolved this in under 1 hour with no injury to anyone. I think that's remarkable as well. The final incident is a series of residential burglaries with sexual assaults. This occurred in April and began in the Boston and Virginia Square community and the Clarendon Courthouse neighborhoods. The investigators had very little to work with in the beginning of this investigation, but through tenacious and comprehensive investigative steps, the offender was brought to justice and charged with several serious crimes, including burglary with the intent to commit rape, object sexual penetration, and multiple property crimes. I'm incredibly appreciative of the work our officers do on a daily basis to make Arlington a safe and enjoyable place to live. I just wanted to start with that, so thanks for indulging me. Next slide. These are the topical areas that I'm going to touch on as we move through the presentation, but I also think there's something else I just wanted to highlight, and that is the focus on preparing for the future. The landscape, density, and complexity of Arlington will continue to develop and change over the coming months and years, so it's important that we continue to focus forward about how we need to change, modify, or adapt to what's to come. And, our staffing study from 2017 determined we should have 405 officers to meet our current service demands. But honestly, our goal at this point is to get back to the 377 that were currently authorized so we can talk about growth. But just because we're not talking about growth at this point doesn't mean we're not very much focused on the demands of the future. Next slide. I want to start the conversation with staffing and retention. As of today, we're currently 72 police officer positions short. The slide on the left shows a 4-year analysis of our functional staffing numbers. Functional being officers who have completed their training are considered functional officers. And, as you can see, over the last couple of years, we've hovered around the 280 functional officers mark. So overall, that chart doesn't depict what we were hoping to see so far, but much work's being done to change that. The slide on the right shows some positive in that if you look at 2021, 2022, the number of departures were 50 and 53, and last year it was down to 38. Now, pre-pandemic, the norm for Arlington Police was around 25-ish a year. So 38 is certainly better than 53, but we still have a little bit of work to do there. And this isn't unique to Arlington. This is a challenge across law enforcement, across the United States. But in the last 4 years, we lost 177 officers, while despite our best efforts, only hired 137. So that leaves us where we are today. One of the things that we watch as we consider things that we need to look at is the vacancy rate. And from the information we have, ours is on the higher side when we're looking at regionally. And I think that has a lot to do with, over 60% of our staff don't live in Arlington, and some commute great distances. And there's a lot of competition when people enter the market to be a police officer. We're all scrambling to hire the same folks. So I think that's part of the reality we're dealing with. Last year, we did see a decline in the number of people leaving the law enforcement profession, which is positive. And of the 28 people who resigned last year, only 5 went to other local law enforcement agencies, and only 2 of those agencies were in the NCR area. And fortunately, one of the 2 has already come back to Arlington Police. So I think that's another positive story. So the question is, what do we do about this? And to me, there's 2 very distinct parts to this challenge. One is recruiting new talent, which I think we're doing everything we can at this point. And the second is keeping the staff that we have. And in my opinion, it's a multi-pronged strategy. Obviously, pay and compensation is a big part of that, and we appreciate the steps that have been taken, but this always has to continue to be a focus. The other part of the strategy, I think, is a lot of internal opportunities. I mean, with our shrinking staff, it's resulted in less opportunity within the agency. So we've got to constantly find ways to give people new opportunity, new challenges, experience something different. I mean, that's one of the beauties of police work is you can go from one assignment to another, and it's like you got a new job. Well, we don't have the movement that we'd like to, but we continue to have temporary assignments despite our staffing to make sure we're giving people as much opportunity as we can. Next slide. So the chart on the right shows our departures by their years of service over the last 4 years. 2020 is more normal looking, where you see the spike at the 0 to 5 years, and then the blue is retirement. As you see, 2021 and 2022 were markedly different in that we lost large numbers between 5 and 25 years. And that is impactful because these are the folks that are very, they're comfortable in the role. They've already learned everything, not everything, but they've learned the job. And that is something to be concerned with. In 2023, we lost 337 years of law enforcement experience. But in the last 4 years, it's 2,100 years of law enforcement experience. So, it's something that we constantly focus on and think about. And if you look at the chart on the left, it shows our current years of service, how long people have been with the agency. And 32% of our current staff have been with us less than 5 years. So taking all of that together, that it certainly indicates that we've become a fairly young police department, and young brings a lot of energy. Another point that I didn't mention was in the time that I've sat in this role, we've promoted about 85% of our supervisors as well. So, this brings a lot of new innovation, a lot of energy, but it also brings a challenge for the department and a focus that we have for 2024 to make sure we're looking at how do we do our best and create clear programs for leadership development and employee development to help people step through their new roles in the agency. And this is in addition to the over 60,000 hours of training that our staff completed last year. Next slide, please. This focuses on recruiting. So I believe we continue to be very innovative and intentional in our recruiting efforts. Last year alone, our folks attended 150 in-person recruiting events, 22 virtual. We're doing virtual recruiting now because why not? And it's something different. Connected with over 1,400 colleges and universities through the Handshake program, which is like LinkedIn for college kids. We continue to have our ambassador program where our folks are connecting with 25 different colleges and universities in the area and on the East Coast. And we've really focused on increasing our advertising, getting the Arlington message out and why here. Another area that we focused is streamlining and modifying our processes. How do we make our application and processing as seamless and easy as it can? So we've added things like remote testing instead of having to travel here. We're using a software program to make sure the flow of the application process is easy. So I think we're doing everything we can to make sure that we're not missing opportunity, but I think we still have work to do here. As I'm sure you're aware, we were authorized to offer significant hiring bonuses, which we did at the end of last year. And it's up to $25,000 depending on somebody's experience. And we also have increased the credit for years of service for prior military and police and where we can start people. Where if somebody with 10 years of police experience comes here, we can start them as if they've been here 10 years. And those are big incentives. So one thing I want to share with you that's positive is comparing January and February of 23 to 24. In 23, we had 191 applications. In 24, we had 502. So that's a marked increase. Unfortunately, it is too early for us to tell if they're going to turn into hires, but that is a substantial number. So I'm excited about that. One of the things that we always look at is the demographics of the last 100 people we hired. We constantly look at this number, and we continue to see that we are hiring incredibly diverse classes of new officers. Out of the last 100 that we have recently hired, 37% are female, 15% are Hispanic, 18% are Black, 8% are Asian, 3% multiracial, and 2% Native American Pacific Islander. So we are hiring classes that are extremely diverse, which is the goal, and that part is working well. Next slide, please. For our output and outcome, we chose to focus on hiring because that's our main struggle right now. And our goal, obviously, is to hire more police officers. But I do want to point out that despite our shortages, with the one caveat of some changes in marijuana use, we have not changed our standards. We are still incredibly particular about who we hire to police in this community. We want somebody that we know will be a good fit in our agency and in our community. So as you will see on that slide with the bigger numbers, I can't see over there, we hire somewhere between 2.3 and 4.1% of the people that apply to the agency. I think that's a good thing because it shows that we're being very selective. I just wish the number was higher. So when you look at the chart, it'll show between 22 and 23, we'll have a lot of increased events and increased applications, but the hire rate was lower. And this is what we have focused on, and this is why we're looking through our entire process to make sure there are no issues or barriers in our processes that contribute to that versus is that just how it turned out. We want to make sure there's nothing on our end we can change or fix. So for our goal, we estimated for FY24 40 new hires. As of today, we're at 21, but we're working hard. We're going to try to get there. I'm a little skeptical, but hopefully we'll get close. Next slide, please. So we're transitioning now to some of the service commitment and how we are managing with our staffing shortage. And I just want to be real clear that the top priority for us remains the safety of the Arlington community. And I think what we've done and what we've tried to do is make change that prioritizes our core services and make sure that we have enough staff working to deal with any serious crime that happens and to focus our investigative efforts on the more serious crime, all while at the same time trying to find a sustainable work-life balance for our officers. In 2018, we restructured the department for a functional staff of 325. And for a few slides ago, we've been in the 280-ish. We've made other structural changes. We've reduced some specialty assignments, and we're actually holding some supervisory positions vacant to help alleviate that. And in 2022, we made the unprecedented change of reducing some service delivery to the community. And, just for clarity, that really resulted in, if it's a late report, you go outside and somebody took some change out of your car, that's the kind of change. Those would be filed online now and no officer comes, because we've got to prioritize what we can do and what we just can't do now. And the final thing I'd highlight that we've changed is we've really prioritized, there's a lot of overtime types, and we have prioritized as an agency the overtime that we need to make sure that we meet our core services, and no other overtime fills until that overtime has been filled. The slide on the right shows some of our overtime categories. And our officers have worked an extensive amount of additional overtime to help us meet our core service objectives. And we've talked about this before, and I had hoped we would be in a different position this year, but comparing last year, our overtime increased about 16.5% compared to the year before. And it's a lot of overtime. If we add up all of the different types of overtime and divide it by our functional staffing number, that's about 12 weeks of overtime per functional staffing member. So it is a big number, and it's clear that this is not sustainable. It's not the long-term solution. But our staff have been great in helping us out in doing this as we get through this time period. But we have to continue to work to find ways to create that work-life balance. Next slide, please. Transitioning to our key initiative of transportation safety. So we're very focused on being committed and intentional in our work to ensure that all the users of our roadways can coexist as safely as possible. And we do this through a two-pronged approach: education and enforcement, in addition to working collaboratively with all the different county agencies and community members about traffic safety challenges. A few highlights from 23. We have several different focused programs such as speed enforcement, red light enforcement, drunk driver enforcement, in addition to our regular patrol function. So those specialized enforcement programs, staff worked about 7,700 hours in those to make sure that we are doing everything we can to keep our roads safe. In addition to we're active participants in Vision Zero. We participate in all the regional and national safety campaigns such as Click It or Ticket, Drive Sober, Get Pulled Over. And we actively investigate every traffic complaint we get. And this is to make sure that what's the best solution. So an officer will look at the complaint. Is it environmental? Can we cut a tree back? Do we need to do speeding enforcement? But we got 235 last year, which is an increase, but everyone is actively looked at. One part of this program I want to highlight is the traffic safety specialist position. This started in fiscal year 22, and the board approved 6 positions, and if you remember, their focus was traffic management, directing traffic at major events, crashes, road closures. They do a lot of logistics like deploying our variable message boards in support of our education campaigns and working a lot of special events. The program has been a huge supplement to our police officers, and I believe has been very effective in what we were hoping to do. And the proposed budget includes adding 4 additional traffic safety specialist positions, and this will allow us to continue to support the sworn staff with added focus on community education, along with we're looking at a couple of pilot programs focusing on bike lanes and hopefully eventually maybe some minor crash investigations to help alleviate the load. So there's more to come on that. I want to give 2 quick updates on Photo Red. VDOT has approved all of our locations. We're working with the vendor to install. We expect completion in the summer. And for Photo Speed, procurement's complete. We're working with the involved county agencies and the vendor to implement. We expect implementation to occur in the summer prior to the next school year. And the initial funding we have covers 10 cameras, so we're trying to figure out now how many. Some locations, 1 camera is sufficient, some require 2, and we're working through that now, but we expect implementation in the summer. Next slide, please. Shifting over to crime for 2023. Now, these are preliminary. We will close the window on the crime stats in a couple of weeks, but these are going to be very close. While Arlington remains a very safe place to live, we continue to see some increases in crime. And with our reduced staff numbers, we've found that it is critical for us to focus our efforts on being efficient and smart with how we deploy the resources we have to ensure that we're responding to the needs of the community and to ensure that we are prepared at all times. So we're very intentional about how we deploy the resources that we have. In looking at the slide, you'll see crimes against persons increased 9.05%. So with Arlington crime, I think it's important to contextualize that because 9% sounds like a big number, and I'm not minimizing it, but that's 176 incidents over the course of a year. And the two things that really drove that increase last year were simple assaults and intimidation. Intimidation is things such as threats, stalking, bomb threats, things of that nature. One positive in that category of crime, aggravated assault was a driver at least last year and maybe the year before for an increase. And last year that number was down over 10%. So that's positive. Crimes against property, the total increase is about 4.5% or 336 incidents. And the primary drivers of the increases in that category included impersonation, which are fraud type crimes, shoplifting, and robbery. One thing I would note about robbery is we looked at robberies through the month of December, and 12 of the 30 robberies in December were shoplifting incidents that escalated into a robbery offense because of the behavior of the offender. So it's just, we've seen, a lot more of that over the last year or so. Crimes against society, the total increase is 14.5% or 83 incidents, and this really is focused on narcotics incidents and the arrest of those who are bringing narcotics into our community. Last year, our officers seized 134 firearms, and 15 of those were ghost guns. And that was the same number, the 15 was the same number we had the year before. So as we head into the warmer months, we focus very much on how we address the trends or make sure we're prepared for the increase in the temperature, which often leads to increase in numbers. One program I want to share with you from last year is from April to October, we had the Community Action Team. This was a group of uniformed officers who really focused on all 4 key initiatives, but they were also used to deploy in areas where we saw increases in crime or specific challenges. Over those months, those officers made 253 felony charges, 315 misdemeanor charges, recovered 29 guns and 11 stolen cars. So I think that was a very productive, and the folks on that detail did a great job. So we're in the process now of exploring different alternatives of how we're going to address the summer months this year, but I do feel like the last year's was very much a success. Next slide, please. Focusing on our opioid incidents, I mean, we've talked about this before as well, and this is an all-of-community crisis, and it's happening across the country. And unfortunately, here in Arlington, we see the total number of opioid incidents increase from 152 to 182 last year, and 182 is the highest level since we've been tracking the number. Additionally, and tragically, we also saw the number of fatal overdoses increase from 17 to 22 last year. And we have just begun tracking juvenile opioid incidents. So you'll see that on the slide. And we'll publish this information on our website monthly. So we're going to begin to share, because there's a lot of interest in the amount of juveniles who are involved in opioid-related incidents. The one thing I want to highlight on this slide is when there's a fatality, an opioid-related fatality in Arlington, there's 2 investigations. The first is the traditional death investigation, and the second is our organized crime section does everything they can to figure out who brought that poison in here and cost somebody their life. So we do 2 very separate but parallel investigations to make sure that we're addressing both things. I would highlight from last year, our officers started carrying Narcan in 2019, and since deploying, it's been used 104 times, 31 of which were last year. So that is an incredible life-saving drug. And we still have our drug take-back boxes, and over the last year, 3,300 pounds of unwanted medications were collected and safely disposed of. Next slide, please. Switching to focus on wellness. So our public safety agencies have collaborated to form a wellness program that supports all public safety agencies. Last year, we were able to hire the 2 public safety wellness coordinators that the board approved for us, and this is a big step in where we're headed. And Leslie and Donna, our coordinators, have identified 3 initial focus areas as they build our program. The first is provision of short-term clinical services, developing a training and education program for our staff, and conducting research and establishing partnerships so that there's resources available no matter what somebody may need. So I'm incredibly thankful for their work. A couple of things I want to highlight that are police department specific. Last year, we contracted with a company to provide a cognitive performance specialist to our agency through the use of seized assets money. We're the first department in the nation to implement the use of a full-time embedded performance psychology person. And this individual focuses on things such as group consultation and training on things like resilience, stress management, physical skills, instructor development, psychological safety, how to be resilient, and how to be the best you can be. And we are seeing the longer he's in your agency, his use numbers continue to go up, and I've heard nothing but great things about that program. Another program that's specific to the police department is we partnered with Frank Ray, a former police officer and country music artist who is very focused on police officer wellness. And he's come to our department a couple of times, had conversations with large groups of officers. And last year he donated the furniture for a decompression room within the police department to give staff a place to go to relax, take a break. So that's very much appreciated. And finally, our continued partnership with the Cummings Foundation for Behavioral Health. And I know you're aware of this, but there's a few things I just want to highlight with it is Dorothy Cummings, the matriarch of the Cummings family, passed last year. And it was she's the one who really wanted to focus on doing something positive for law enforcement. And it's not just for us, we're being used as part of an evidence-based program to develop programs that can be shared with other law enforcement agencies. And, her family has picked up her wishes and her legacy and continued this program. So we very much appreciate all they've done. They've donated over $1 million in services to date to the police department. And the programs that are occurring include things such as yoga, physical fitness, specialized blood screening and lipid panels, dietitian consults, resiliency training, et cetera, et cetera. So their partnership has been huge and is very much appreciated. Next slide, please. Switching to community engagement. So we've done community policing since the late 90s, but this is the first period in our history that we have a dedicated division that focuses on engaging with the community. And it's not just the folks that go to normal meetings. Their charge is really to get out and focus with people everywhere across the community. And our engagement division is divided into 3 functional areas: community engagement, business engagement, and youth engagement. It's important that we maintain relationships in all 3 areas. And as the sheriff mentioned earlier, we're incredibly thankful for him assigning one of his deputies to be a part of the team. She's fit right in and does great. But to give you a highlight of what this small team accomplished last year, they attended 196 events, 336 meetings, 90 presentations, in addition to some of the events that they participate in or host. And some of those include partnering with APS to conduct classroom presentations and discussions, a partnership with the ARC of Northern Virginia, where twice a year individuals with disabilities and their family members come and practice interaction with public safety officials in a non-threatening environment, just to see how things go. We hosted 4 community police academies last year. 2 were teen, 1 was Latino. And we continue to have Coffee with a Cop, Pops with the Cops, Pride with the Police, and Pupusas with the Police, in addition to our Fill the Cruiser events. And our Latino liaison officer continues to do a lot of educational programs and forge really deep and meaningful partnerships and relationships with the community. Next slide, please. A program I want to touch on briefly is the cadet program. This program came after we identified the need to have early interactions and engagement with college students who are interested in a career in law enforcement. This program gives college students who are interested in law enforcement an opportunity to get comprehensive on-the-job training with our department while continuing to work towards their degree. The training is really crafted to help them have a thorough understanding of the agency and to bring them into our agency, because the goal is that they transition from cadet to police officer. So we actually launched the program in February of 2024. We have 9 cadets who are fully on board now and have started their training, and you are likely to see them out in the community at different community events. Next slide, please. Our equity program, as an agency, we certainly recognize and we're actively working to ensure racial equity in all that we do. So I want to share a couple of specific initiatives and programs that highlight this work. The first is our partnership with the Center for Youth and Family Advocacy on Restorative Justice. We entered this partnership to divert minors away from the juvenile legal system to a community-based restorative program for eligible offenses. And since it began in August, I think, we have diverted 35 different offenders to this program, and fortunately, none of them have been returned for noncompliance, so that's a very positive thing. The other different program I wanted to highlight is really about building relationships across the community. And this is the police department's tutoring program. This is a partnership in collaboration with AHC and the Life Enrichment Center. And it's an avenue for our staff to tutor and build relationships with youth in our community who've been identified as reading below grade level. This began last year with just the police department employees, but it has grown to a total of 47 different dedicated volunteers from the police department, fire department, and sheriff's office who go to 2 different locations in the community and spend time with the young folks who've been identified. And it's really a collaborative effort, not only that fosters academic growth, but it embodies our commitment to promoting equity and opportunity for everyone in our community. And everybody involved with this, I have never heard anything but complete joy doing this work. Next slide. The final slide is the summary slide. I think I would just highlight that it shows 11 additional FTEs. 5 of those are the cadets. We're authorized 10, but they're half-time positions. The 4 traffic safety specialist positions and the 2 PSIT positions are being transferred from the sheriff's office to the police department. They're already embedded, but we're just putting everybody under one umbrella. And I think with that, I'm happy to answer your questions.
Thank you very much. All right, colleagues, who's first with a light? All right.
I just did want to note, because we posted on the web, we have a pretty detailed set of information on public safety wellness.
Yes, and I didn't know if you were going to do that after.
So I know Andy covered the general overview with that. There's a lot of material in here, but you had asked, Madam Chair.
I had.
For a lot of detail on that, and rather than spending the next 20 minutes going through that, there's a lot of things that you could look at it. Yeah, you could look at it and then let us know if you have questions.
That's great. And actually while Matt's getting his question, have we sent the Cummings family a thank you note? I mean, how are we, it's something, I feel like as chair, I should send them a thank you.
We will put something together for you. I would love that.
Pleased to do that. I would be
Great,
pleased to
thank
do
you.
that. I'm sorry to have missed this.
We have sent several thank you notes and, T-shirts and things, badges, things like that, but they would love
We've
it.
actually sent the chief of police out there to thank them
We did do
personally.
that.
Oh, good. But I would be happy to do a
Thank you.
note. Yeah, no, thank you. All right, Matt, go ahead.
Thank you. I think really two total questions. One is, really appreciate the reference because I had not gone back to the staffing study from 2017. I'm glad that gives us a sense. So the traffic positions, are those counted in our vacancies or not? Because those are functions that may or may not have been analyzed in the needs analysis, and one of your key initiatives is traffic safety. So do you know? Or?
No, they wouldn't be included in the 2017 analysis, and I do want to do another analysis because that was pre-Amazon and all that, but I think, because that one's dated, but I'm waiting till we start knocking out some of the 72 vacancies before we do that, because I don't want to do it too soon and then it become outdated right away. Does that make sense?
Sure. No, I'm just thinking about how we've discussed so much, and I agree with it, that that some of the functions that officers are being asked to do are social work or other functions, and yet, I'm also mindful of the regular reminders I get about Clarendon nightlife. And so, just balancing all of that. So that's helpful. The other question I'm curious about, I don't know if it's a manager or it's a follow-up or it's a you both question. You mentioned the $25,000 signing bonus. We also have a retention incentive that we have put in. And that is, I'm curious as to, I think that's from existing budget. But I'm interested in, I'm mindful that we're in the middle of our collective bargaining. I also love to incentivize folks going forward to live in Arlington, mindful that folks go through 3 counties to come here, and that we're midstream. But do you have any anecdotal, or either of you have thoughts about, about that possibility? Because we have heard about the length of the commute. Our live where you work is a modest incentive, and I sort of floated this last year, but I have heard from officers. I just don't know if you have thoughts about that piece to things, given that we are challenged by all our local jurisdictions, and we are at 23% increase, which officers rightly feel is not enough, but we're going to be at 26% increase over 3 years. Live where you work, that sort of incentive, do you have any thoughts there?
Okay, yeah.
You go first.
I was just second.
Then I'll correct you.
Okay. So, yeah, I mean, I think, like on the slide showed and what I was trying to convey is we lost, you know, the group of tenured officers that we lost. I mean, it was to lose somebody who's 18 years into a career, that they left the profession, but, you know, the best thing for the agency is we need to keep our experience here. I mean, I asked to do the bonus. I completely own it. I can't say that I'm a huge fan of it. I mean, I resisted as long as I could, but it's what the region is doing. So I do think it's important to constantly look at different ways to make sure that we keep the folks that we have here, because I am very blessed to have exceptional staff, and I want to keep every one of them if I can, because, you know, it's important to have people to rely on. I remember when I was new, you know, the new person sat in the front of the room. There was a bunch of older folks back there. Well, the older folks are not, they're not as plentiful as they used to be. So anything we can do to keep people here, I think is, you know, getting new people and keeping people are my two key priorities in that area.
So I was going to add two things. First is that we have spent some time working with our affordable housing providers to see if they can provide opportunities for reduced rent or low rent units for our officers. And that's been somewhat successful. The other thing is we've worked with the local credit union to try to get better terms on loans. But I think I've said this before, and I didn't put it in my budget, and I don't think we're going to be able to do it in our budget unless we have a dedicated pot of money for creating workforce housing. Okay, I'm not saying we do, but we should. Our AHIF fund is a phenomenal tool, and it's focused on people making a certain percent of AMI. None of our police officers or firefighters or teachers qualify for that fund. So until we create a fund like that, or this board has worked quite hard on affordability of our housing stock and our rental stock, that is where the main challenge lies. And so it's beyond the scope of the police department. But I know that part of my idea with this new retirement proposal outside of the collective bargaining is like to put more money in the hands of our people, but employees. At the end of the day, the challenge of housing costs is profound. And I don't want everybody to think that by doing onesies and twosies with our affordable housing providers, we're going to solve the problem.
Yeah.
Thank you. I just would say that the idea that I was, you know, mindful of is not just rent, but also our incentive on our live where you work on ownership is not enough to reach. And so I'm
right. And I will just say this, we've added money to that. Adding more money to it also, I think, would be possibly a good idea to do. We've had a lot of uptake, I think, from police department and other staff.
I think so. I don't have specific numbers, but it's a good thing.
Absolutely.
Thank you. And I'm also mindful, again, collective bargaining is a pretty honest and open sort of direct assessment. So I just laid it out there. Thank you.
Yeah, thank you. Colleagues, I was just cruising along here. There are no commissions for any of our public safety except the Community Oversight Board, and the chair of our Community Oversight Board is here to provide comments, and I really apologize. Ms. Evans, would you like to come forward? I think I see you. Yeah, come on. I apologize. We were just kind of cruising through, and I got into the rhythm and forgot about it. I'm so sorry. It's fine. Thank you. And I think you had a few comments for us, and then we'll get back to questions again. Yeah, you're on. It's good.
I'm good?
Yeah,
Okay.
you're good.
Excellent. I know I am also standing between everyone and dinner, so mindful of that. I want to say thank you. Anyone who's still online, appreciate that. We are still relatively new. I'm the chair, Julie Evans, of the Community Oversight Board for Arlington County Law Enforcement, representing a group of volunteers and also our IPA staff working for the county manager. So I'll get through this a little bit quickly. I have two things. The first thing is just our reflections on ACPD's budget. Chief Penn was very gracious to go through this with us in advance. From the code, our participation in the ACPD budget review is meant to support budgetary recommendations. We're kind of working through our understanding and familiarity of the programs from an operational standpoint. So today I'll be brief. Next slide. We want to amplify our support for some of what ACPD is putting forth here. Really, really impressed with their leadership and cognitive performance specialists, obviously officer wellness being very key. The traffic safety specialist, we joke this isn't just because my day job is as a traffic engineer, but I do see a lot of workforce and kind of operational efficiency and effectiveness in reducing the burden on sworn officers and promoting effectiveness there. And then also for the kind of aspects of website modernization and recruiting reinforcement, recognizing that we do have a very, very talented workforce and wanting to be able to retain and attract top talent. So the first thing I'm here today is just to amplify that we really support a lot of what ACPD's budget focuses on and want to reflect that to the board. Second is to start a conversation, I think, about the IPA and COB budget. I don't expect anyone to read this. This is, a bulleted list of what's in the ordinance in terms of the activities needed to increase and maintain trust between ACPD and the public. The ... there is all of the MOU stakeholders, so that's not meant to be not transparent. But really, the value of civilian oversight is a big and in-depth process of engaging with ACPD and the community to understand what are the issues, what are the processes, and how do we be proactive? How do we reflect ACPD's efforts to identify opportunities to make changes that are focused on public safety and create kind of a stance of community policing that's effective and reflective of our local community needs. So our hybrid this entire time has been in proactive partnership to take into account national best practice and make sure that we're making decisions about what's right for Arlington. So that's still kind of the learning curve we're on. We'll go to the next slide. At first glance, it looks like financial support has declined. I think these numbers are a little bit difficult to interpret. Our initial year budget was $100,000. That was $25,000 of overhead and $75,000 of operating budget. We only had that budget for 2 months, so I think we spent close to $40,000, which may be where the budgeted fiscal year 24 number and proposed fiscal year 25 numbers came from. I don't think that's reflective of our need, and I think it's a little bit difficult because this is a new function, and we're trying to figure out what are the costs. A lot of times government looks to historical spending and comparable spending, and so we want to focus on kind of what is needed here to make this a meaningful endeavor and not a kind of administrative function. So next slide. The NACOL, National Association of Community Law Enforcement Agencies, recommends that 1% of the non-personnel budget is a good standard. When we look at our regional comparison, we have the lowest budget and the highest kind of case output right now. I promise next year this will be formatted in outcomes and outputs, but so far this is what we're working with. So we are churning out a lot more work than our regional peers from the national landscape. Cleveland is the closest on that list to our population. They've got about 50% more population and about 20 times our operating budget. So these are data points to sketch out the corners of what are we working with, what are we working towards. But what we really want to reflect here from NACOL is that budget equity is what's going to give us the capabilities to deliver high performance services and advance equitable outcomes. So the next slide, we'll talk a little bit about what that looks like. This is that list again in terms of what we are able to do, what we're trying to do, and what we're not really able to do given our current kind of budget and staffing footprint. On the right in green are the list of my other volunteer members who I appreciate and couldn't ask to be here today. In blue are Mummy Ibrahim, our independent policing auditor, and Ian Lazarenko, our management and data analyst. Really, really critical to getting anything that we're doing done. I mean, if I could duplicate both of them, I would do it at least once, if not twice. They're working constantly and fielding phone calls from the community, from members of my team, and coordinating with ACPD and the county board and county manager. So there's a lot of work that's going into this. I think that the budget is directly correlated to performance. What we've seen with other agencies in terms of staffing is they have multiple investigators, they have legal advisors and legal assistants, they have community liaisons, public information coordinators, executive assistants. The other thing they all have is a backlog. So we're working really hard right now. We're meeting twice a month. Mummy is working, tirelessly to go through all of the investigation materials. That's not something Ian can help her with because of access to evidence. And so we're dealing with our backlog. That is our top priority. That means we have not gotten to community outreach, which is something that the community has come to me personally and multiple of our events to say, we want to hear from you. We want to be able to talk to you. We want, to talk about different strategies that are appropriate for different kind of regional subgroups. So that's kind of what we would like to get to. And again, I recognize that we are still on the front end of building this out. So we want to start a conversation about how we make this meaningful in Arlington as, not just representative of what national best practice is, but what our local community wants. Next slide. So I've seen different numbers for our budget. I think a lot of what I've seen in the proposals look administrative, and I want to give some voice to what we're looking for when we're looking for a more substantive budget. Access to experts and training, these are things like as we go through case by case, both Mummy and Ian have very, very relevant qualification and past experience, and they have offered us a trove of knowledge that's extremely helpful, but there are kind of specialist issues that we have to be able to access people. If we expect them to go get trained on all of those things, we'll never keep up with our backlog. Outside counsel, this is just, this may get less over time, but especially in standing up, this is a very sensitive new type of work, and so being able to consult our lawyer is about half of the budget, I think, that was proposed for experts right now. Again, community engagement, I can't talk about that enough because I hear about it constantly. I get, phone calls and emails and text messages, and then additional support staff. As I said, I think there are lots of different types of support we may need over time. As of right now, I just want to put into the conversation my support for I think the original conversation about staffing included a deputy police auditor who would also have access to evidence and be able to help process the backlog, and also a policy analyst, somebody who can help us take some of our individual findings and understand and do the research of not just national best practice, but then, kind of local Arlington operations. So I think that Arlington is a very well-resourced and very fortunate and blessed community. I think we have the opportunity to take this civilian oversight endeavor seriously as a leadership role. I think we really have a responsibility to expanding the experience of all of our citizens to feel comfortable, trusting, and safe with the police. And I think that a lot of the programs are currently in place to do that, and I think we want to be able to expand that in a leadership capacity. So my last slide is, anyone still listening, please join us in person for our next meeting. And then I welcome any questions from the board.
That's great. Thank you. We'll stay here because we might have some questions.
Sure.
Appreciate that. And
Yeah.
just want to recognize, too, all of the work that you and the members of the COB do, because it's just an incredibly large lift with all the training and everything you've done to try to get things started. Thank you.
Thank you.
All right, back to questions. Ms. Cunningham, Susan. Oops, you're late.
Oh, I've been doing so well. I just wanted to amplify that. I think we talked a lot about overtime across all of our public safety folks, and though you're not getting paid for it, a great deal of overtime for the Community Oversight Board, kind of figuring this out as we're flying the plane. And I know it has not been easy, but really appreciate the, probably better not to count them, but the large number of hours you guys have put in to get the training and then to begin to tackle the backlog. So thank you.
Thanks.
Maureen, it's coffee.
All right, not COB, I apologize. Feels like a hard left here, but thinking about what we've seen from the sheriff's office on the increase in serious mental illness in folks who are being arrested and detained, can you talk a little bit? I know we've stood up crisis intervention services, and that's getting off the ground and starting to help, I think, but Can you talk about the training that officers receive on handling incidents with mental illness involved or opioid or substance use involved, both in the academy and then also throughout their career?
So sure, I think what you're talking about is the crisis intervention training. I think, and I'm winging this part a little bit, I think it's 8 hours in the academy. It's not a ton of training, but we have a setup where our officers complete field training, then they go to work for a cycle, and then we're now sending them back to crisis intervention training. And COVID messed us up. We were over 80%, but I think, Chief Vincent, I think we're back over 80% of our folks.
We're actually over 90%.
So crisis intervention training, just to give you a little context, is it's focused on a lot of different things, but it gives an officer a perspective of different mental illnesses and what behaviors they may see if somebody is experiencing a crisis and they have whatever diagnosis. It's not to make the cops diagnosing people, but it's to help them understand what they're seeing. And then it really drills down and focuses on de-escalation skills through active listening. And it's one of the few trainings that we do post-academy where there's role playing. I mean, that doesn't happen all the time, but in this class, it's important because it gives you an opportunity to exercise the new skills that you have. And I think it's incredible training. I used to be the coordinator for that. And I think that, that's one great example. We've had other specialty trainings on autism and other things, but crisis intervention training, our numbers dipped down because COVID, everything stopped. So our focus over the last year and a half has been to get our crisis intervention trained folks back up over the 80% mark. And we just learned we are. That's good.
Yeah, that's great. I'm really glad to hear that. I think that is a skill set that's really, really critical as we start to disentangle this issue of relying on criminal justice to treat mental health.
No, I agree.
And then relatedly, can you talk about how you've partnered or interacted with DHS in terms of these situations?
So one thing, I want to go back to crisis intervention training. I mean, it's not, the skills that are taught in that are not just on calls involving mental health. The de-escalation and the active listening, it goes beyond work. I mean, it's just, I found it to be very important, and I thought it was really good training. Now, sorry, I'll go answer the question. We engage regularly with DHS. So Chief Vincent and I meet with Anita Friedman and Deborah Warren monthly to talk about how do we keep our partnership, how do we make sure we're doing what we need to be doing. We actually have a lieutenant in the police department whose full-time job is to be our liaison with APS and DHS. So that's a lieutenant's full-time job to make sure that we are working with APS in all the ways that we can, and to make sure that we're engaged with DHS to make sure that we look for every opportunity. As the manager mentioned earlier, the law is pretty proscriptive in the Commonwealth. And if somebody doesn't meet the criteria of that they have a mental illness and they are, homicidal, suicidal, or so ill that they can't care for themselves, we can't force things. And I know it frustrates the officers. I know it frustrates the community. But we often find ourselves in a position where somebody doesn't meet that criteria, and if they don't want help, then we can't force help. But then we get in a scenario if they're on somebody's property or if they've done something to somebody. I mean, I think there's much work to do on this. I mean, I think the fact that Monday we had 2 officers have to drive somebody from Arlington to Bristol to go to the hospital is absurd. But that is the situation that we're in. I mean, the state hospital system, I get it, there's staffing challenges everywhere. That's not that unusual for us to drive that far. And the tragedy of this is that we have folks who need help sitting in hospitals for 2-3 days, not getting help, but waiting for a place to get help. And, the officers, yes, we have to have people with them, but at the end of the day, the person who needs help is not getting help. And I think that it's better than it was, but it got to the point where it would not be uncommon to have 4 or 5 officers tied up at the hospital at the beginning of a shift that starts with 15. So we actually hired back. We were very fortunate that 3 of our retirees wanted to come back full time, and that is pretty much what they do for us full time.
Wow.
because it's that much of an impact. And, you know, our partnership with DHS is great. You know, we're working on the CIC becoming more, you know, having more hours to be able to take more. And the VHC partnership in a couple of years is going to be monumental, but that's in a couple of years. So I think there's a lot of work to do. Sorry, I just kept on going.
No, I appreciate I too could keep talking about this, but I think it's my time.
Yeah,
so.
okay, well, thank you. All right, Takis. Yeah, I'm sorry I don't have the little hour glasses. This is the day we need to
Thank
hit.
you.
Mr. Karantonis.
For me?
Go. No, not. Although maybe.
Sorry.
That's all right. Just, they would do for everybody. Mr. Karantonis.
I mean, I appreciate the passion for that because this is really very important. I mean, it probably even saves lives. I mean, I'm sure. I mean, we struggled a lot to get to the Crisis Intervention Center to get it, you know, working, and I'm happy to see that, you know, the entire department is tuned in, and it provides the support to the officers that we need to support. I have a couple of questions on, first of all, on the age, you know, the demographic on your slide 6. So we are 32% is under 5 years of service, about 42% is between 5 and 20, and 20 and above is 26%. So what would be an ideal distribution? I mean, to me, to a layperson, this looks relatively okay. What I don't like is the very high volatility of the first 5 years. I mean, but other than that, this looks like a, you know, sturdy.
So let me complicate it for you. Put 40 more in that 0 to 2.
40 more in a 0.
When we start hiring,
Yeah.
I mean, you know, we're a young workforce.
So there will be
general.
a shift towards the younger part.
Even
Well, like if all of a sudden we can really start filling our ranks, you know, we've gotten young, you know, 85% of supervisors, 32% of our staff now, but if the moons align and we start filling our vacancies, that 0 to 2 category number is going to go up quick. And that was my point of, we really want to focus on making sure we have defined training programs beyond field training to help people step through their career, both leadership and for all employees, to help people step through it quicker, because I would like to say that 40 becomes 110. I don't think
Some of them could be lateral.
So
that'd be great.
50% today is less than 10 years. So we can consider them, you know, 10 years is a career already, right? So, but we can consider, I see what you say. I'm trying to you know, understand the consequences of that. So how do we have to receive these first recruits that come also from a very diverse, you know, pool, etc. What are the key dials to manage there so that we have higher retention besides money?
I think it's, you know, one is opportunity. So, you know, we have shrunk our investigations division by, I don't know the number off the top of my head, but many positions. There's 5 sergeant positions that I've not promoted. There's 2 captain positions I've not promoted, because we've got to make sure that we keep the number of folks that are available to work in patrol beats steady. And so I think opportunity is a big deal. And it's because it is truly, when I started as a midnight cop, and I did that for 5 or 6 years, and I went to CID, to auto crimes, and it was like I got a different job. I walked in, thought I knew something, and then learned I didn't know much. So that's great opportunity to learn new things, do new things, and I think that's really important.
I will be following up with you on this because it's not part of the presentation. We didn't talk about, you know, the job that detectives do and, you know, the economic crime, et cetera.
Sure.
So
One more question?
One more question, and this goes to COB. So 1% of the non-personnel budget, $77,000 is good enough to keep the lights on, if at all. So a deputy, how would this help with the workflow and with the, you know, the intake of cases that you have today? And apparently it's, you know, a struggle to
Yes.
dispatch them fast enough.
Part of our challenge is just that there is a lot of evidence for each case for the volunteers to go through, and a lot of what we're still working out is how do we make sure that our discussion is armed with a full understanding of all of the evidence relevant to each of these complaints. And right now, Mummy is the only person who can help us kind of filter through and go through that. So we've reviewed 6 different investigations this year. Mummy has cleared 77 investigations since 2023. So she's going through all of that evidence to kind of process and filter what are more minor kind of complaints and things that can be triaged as, you know, our complaints are up 20% since 2022. And so handling that increase and being able to go through and filter and simultaneously, so she has to do her concurrent investigations and also prepare us to go through those investigations. So she is very much kind of straddling 2 jobs in that function because of the restriction that she's the only person authorized to access that evidence. So part of that what is the word I'm looking for at the same time? Concurrent investigation process is providing input and feedback on what kinds of questions is the COB going to want answered. And, you know, as part of this, like, it's not an administrative function, right? This is an expert function to go through lots of evidence, analyze it, and then also equip a very large and unwieldy volunteer board to understand all of the relevant issues, mobilize all of the policies. And the Office of Professional Responsibility has also been very instrumental in processing and marking and doing a lot of preparation of that evidence. But I think both of them are kind of backlogged with the amount of data that involves processing on a regular basis. So to me, that's the front end of what we've already done. The second part are some of the functions that we, because we're just on the front end of doing these investigations, are still getting into, which is use of force audits and different functions that I could not expect Mummy would be reasonably able to do in parallel with all of the work that she's currently doing.
Okay, thank you. I may follow up with you on that.
Yeah.
I also don't think I said that the 1% number is $109,000, which going through the rest of the budget is, you know, it's commensurate with some of our spending on.
Above $109,000,
Right.
that I understand.
Sure, thanks.
All right, thank you. Ms. Cunningham.
2 quick ones, I promise. One on the housing. Is there a way that we could have housing provided as part of the training? So while you're in your academy, you don't settle near the academy, you wait and settle near your job?
So I think we could look at that. I think it would really be probably more of a stipend because our academy's in Ashburn. So, we see a lot of folks that when they go to the academy, they get somewhere to live out by the academy because it's a drive.
Right. We could rent something in Ashburn for that, but have it be short term so that then when they're done, they could come back. And I think the sheriff has the same challenge, maybe fire does too. So last one is, we hear a lot from the community about Clarendon, as my colleague mentioned. Can you say anything about sort of the number of people that are there each night, the number of incidents, and whether that is concerning? I know your team puts a lot of good effort into managing that. And in particular, if there's over-serving, does ABC board respond promptly?
Sure. So I don't have the specific crime numbers for Clarendon. We can get that if you'd like it. Over the years, we've increased the amount of time that we've had in Clarendon, but I think we talked about this some, that we went to a period several years ago where we were putting upwards of 20 officers in Clarendon to maintain calm. And then we really focused on the Arlington Restaurant Initiative, really partnering with the businesses and the security staff. And that's been very instrumental in getting us back to a normal level. But in looking at the amount of time that we've spent there, or the amount of time we spent last year increased to like 6,600 hours because we added Sundays. We found that a lot of the businesses, in order to meet their rent obligations, have added Sundays and have promoters coming on Sundays. So we used to just have a detail Friday night and Saturday night, and now it's Friday night, Saturday night, Sunday night. So we've really increased and added a whole extra day. But as far as the incidents, we continue to see certain incidents that do occur. We've had incidents that have involved firearms, but I think that we're back at our normal traditional staffing level. That the challenge is continuing to maintain that pace, I think.
Great. And then a comment, not a question, but could we consider civilian support for that in some fashion going forward as you're getting the traffic safety folks up?
We do have civilian support for some of the parking challenges that we deal with, but they're directly communicated to the police. Several years ago, we piloted having some of our auxiliary officers drive through the neighborhoods, just so it was a police car riding around the neighborhood. But you never know what you're going to run into. So we can look further at that, but we ran into some challenges when we did that part before.
Yep. Matt.
Thank you, Madam Chair. Thank you, Ms. Evans, for the presentation. If you could send that slide deck to us, that'd be great.
Certainly.
Thank you, Ms. Ibrahim and Mr. Lazarenko, I think I've got the pronunciation right, for your continued work. The last slide was particularly helpful on the functions that we're focused on, and that's kind of where I would start. I'm happy to engage with Mr. Karantonis. I've talked, of course, with you, Madam Chair, about this. It's a process. I'm aware of the 1%. I would rather be function-focused first as to needs. I can say that want to be mindful of the challenges of standing this up and all of the time that the 5 other members have spent. I am committed to this. I'm committed to this now, and I'm committed to this next year, period.
Okay, thank you. And I think, Ms. Evans, as I think I talked with you a little bit, I'll be interested. I'd love to get the slide deck. Thank you. Looking a little bit at maybe one-time funding to get rid of that backlog, and then we'll see. I think, you're trying to stand up. You're trying to build the plane as you fly it. So maybe we get some help, flying it and getting it built, and then we'll see if that needs to be ongoing or not. But that, at least that might be something that we can do. So appreciate you bringing us to our attention what's needed. Okay. I think we're set. Andy, do you want to talk 5 sentences about regional cooperation or so? Because I got you haven't said a word about working regionally, and I think you do a fair amount of that. So I think folks ought to know.
We do. We very intentionally work at different levels throughout law enforcement. So at the top levels, we interact a couple of times a month to make sure we're supplementing what each other are doing. We're active in COG. Our tactical teams regularly interact. Our investigators regularly interact. I mean, in an area where there's so many jurisdictions so closely linked to one another, without working as regional partners, I think we'd all be very ineffective. And I think we are very committed and focused to working in that fashion, and we do a lot of it.
Thank you.
That was more than 5, but
no, it's all
I
right.
tried.
And because I'm remembering, I think it was hijacking or something. It was a group of people that were and the whole region came together and they got them. But it was a whole regional team effort to do what needed to be done. So I just want to make sure people understood.
Sure.
That. All right. I think we're done.
Okay.
All right. Thank you so very much for everything you do. This is a very hardworking, efficient, and smart police department, and a caring one. Thank you. Really appreciate it. We'll see everybody back here. If you're interested, we're going to be meeting with our school board colleagues at 3 p.m. right here. See you in 24 hours or 22.